discrimination, and it doesn't have to be addressed by the defense, but
Okay, the camera, folks, the camera just came up.
A
Let's
person
take a look.
functions in real life. The person is not just a diagnosis. A person is a person. And we also have to look at outcome. We have to understand, for myself, when I look at, as a pediatric psychologist, what might their outcome can be. What interventions do they need? How do we make the progress of their life as successful as possible? Whether I'm dealing with a child with facial burns, or a child and family that's dealing with cancer and the long-term effects of that they have neurological effects of cancer too and treatment. So what's important about the pediatric aspect of this is understanding any defendant, including Tanner, not just at a point in time, but understanding how he got to that point in time and what could have been different or made different for that particular person.
Dr. Bond, if you'll please explain to the jury a little bit about your experience in evaluating and treating children.
Absolutely. I always wanted to be a child psychologist. I ended up doing something somewhat different, but all that expertise is never an experience. It still colors what I do today. So when I said, earlier in my career, we're talking the late 70s, 1980s, I was a pediatric psychologist, as is stated in Michigan and in Ohio. And then I went to private practice. I was by myself for a while. I ended up having a lot of employees. I would not recommend that. But I saw hundreds of children, adolescents, and families in that private practice setting from about 1986 until about 2019. I also, at that point, was asked to do juvenile forensic psychology. And there really wasn't forensic psychology, like formally at that point in time. But local juvenile courts were asking me to do evaluations on people much like Tanner when he was an adolescent. Juveniles, although he did not get in trouble, but juveniles who were before the court, whether they were competent to testify, whether they should be tried as an adult, where they should be placed. And so I've had all of that experience in that area as well. Obviously, over the last 40 years, I've dealt clinically and forensically with a lot of juveniles and a lot of families and children.
When looking at cases, how important is it to involve the family as well as the children in your evaluation?
Well, it's important both clinically and forensically. As a clinical psychologist, Ms. Anderson, if you take your child to a therapist and they only speak to your child, that is really not fruitful. And it's also, I don't think it's professionally appropriate. The issue is none of us live in a vacuum. And a child especially is highly sensitive to a parent's parenting style, their ability to help them, their resources, all of that. And so as a clinician, I can't imagine just seeing a child without taking history and having a real knowledge of that family. As a forensic psychologist, I have an obligation to go back as many generations as I can and understand a person's history. So from a forensic perspective, it's my duty to speak to relatives, not every one of them, but pertinent people, speak to other sources of information in order to get a real holistic picture of that individual. So I would treat a forensic client such as Tanner in terms of gathering information, much like I would treat one of my clinical patients.
Dr. Bond, you said that you had always wanted to be a pediatric psychologist. In your career, have you published a lot of papers on that topic?
Early on, I did some papers. I did my dissertation working with children who were biologically dysregulated and have hard time feeding. It's called non-organic failure to thrive, where you have problematic parenting and a child who has some type of impairment. Looking back, probably something like Tanner's, and working on a program to help them be able to eat and relate and function with other people. More recently, I've had peer-reviewed publications about trauma in the courtroom and how that's assessed. But I've also written a lot of books on educational psychology, test-taking skills, anxiety management, that type of thing.
Now, you practice in Ohio, so I assume your license is in Ohio.
Yes, that's correct.
Where else are you licensed?
I have a full license in Texas, obviously, and I've had that for many, many years. I'm licensed in Idaho, and I'm trying to think where else I'm licensed. Texas, Oklahoma, and Oklahoma as well. And then if I need to go to other states, I get a temporary license.
You talked about doing forensic psychology, and that involves the courts, right?
Yes, ma'am.
All right, so how many times have you testified in proceedings?
Many times. Not obviously as many as I've evaluated people, because many times cases get settled or other things happen. But I have been in state courts, federal courts, even military courts. I would say I've testified maybe 100 times. It's a guess.
Oh, I'm sorry. What about juvenile court?
Good boy.
Many times.
And why is that relevant to a case such as this?
It's relevant because I've done so many juvenile evaluations, especially earlier in my career, that to understand how a child develops and where they are at a point in time and what their choices really were. You know, what do we do with a juvenile who has not had the family background that all of us may have had? How do we give them interventions and keep them out of that system? All of these things are very relevant. So this whole issue about development has a great deal to do with many cases in juvenile court, and I think many cases in adult court as well.
Do you often deal with cases involving capital murder?
Yes, I do.
How often?
I don't know if I can answer often. I can say that I've been involved in approximately 50 cases over the course of my career. Many of them do not go to trial.
Any other questions, Your Honor?
Yes, ma'am.
Yes, ma'am? Yes, I do, ma'am.
What do you recognize it to be?
This is my resume, and it is 27 pages in length.
Is this a true accurate representation of your experience?
Having spoken to my office yesterday, I would say yes, it is.
Okay. Your Honor, this time the defense offers defense exhibit number 47 called witnesses.
I think you did. Okay. Defense 47 is admitted.
Dr. Bob, I want to talk to you a little bit about the case involving Hannah.
That's fine.
You were retained by the defense in this case, is that correct?
Yes, ma'am.
All right, so, Dr. Bob, what is your hourly rate?
$350 an hour.
Is this standard for experts in your field?
There's a wide range. I would say that I'm at the lower end of the range for forensic experts.
Approximately how many hours have you put into this case so far?
Well, that's hard to estimate. I know what my billing is up to this point, like just before this week, but I've put in many hours into this case. I've traveled, I've spoken to witnesses, I've spoken to panel, I've reviewed volumes of records, so it's many hours.
What have you billed so far?
So far, and this is just an estimate, until this week for preparation, over the last 2 or 3 years, I've billed $28,000 and then some expenses for flying and hotels when needed.
$28,000 for this
What have I
ticket.
been asking before?
Wow.
But I'm curious, do you
Paid for by the
accept every
taxpayer.
case that you're approached to take on?
No, I do not.
How do you determine which cases you'll accept and which ones you won't?
Well, first, I mean, ethically, if someone asks me to do something that's really not in my wheelhouse, I would not try to ever go to court with it in an area that I'm just not familiar with. I also talk to the attorneys, and if I believe that the attorneys are asking for something like to be their mouthpiece, I have attorneys call me up and say, oh, just go to court, this is what I want you to say. We politely not only hang up, but do not use them again. So yeah, I would say, Ms. Anderson, that not just capital cases, but all cases, I do civil cases as well, like personal injury and workplace issues. I would say I turn down about 15% of the people that call me.
Why did you accept this case?
Well, first of all, when your team first spoke to me about it, you mentioned your concerns about development and your concerns about neurological issues such as neurodevelopmental disorders. And I knew that I had a lot of experience and interest in that area. I also know that your group does a very comprehensive job of getting other experts, that I would not just be on my own in doing this, but I would have solid information to back up my testimony. I had known you before. You seemed very determined to do the best job you could, and I felt very comfortable doing this.
Alright, so let's talk about the case itself. What were you asked to do in this case?
In this case, I was solely asked to look at Tanner's developmental history and how that impacts his functioning over the course of time and prior to the offense.
When you look at a case and agree to accept a case, what is your process? How do you begin your evaluation?
Well, generally, I ask whoever it is, either defense or prosecution, I ask them for, or whatever attorney, for as much information as possible to get ready to see a defendant or other, what we call collateral sources. So I ask for everything. I don't want things in a summary. I do not want an attorney to summarize records for me because I need, as the expert, to have availability to those records. Okay, some experts want to have a summary. I don't do that. Obviously, I don't need to read every page. If it's a medical record, for example, and they repeat the person's name and address over and over again, I don't need to spend hours billing for that. But I need to see information because I, as an expert, have an interest that might be different or a need for certain information than, let's say, an attorney. Okay?
You mentioned a summary, and you don't rely upon summaries. Why is it important to have the actual record and not just a summary provided by an attorney?
Well, first of all, attorneys are not psychologists. And the things with information that an attorney might summarize may not be the information that's relevant, those key factors that might be relevant in expanding my understanding of a particular defendant or person. So I need to be able to look at those records myself, and my job is to come up with hypotheses. As I sit at my desk and look at records, I don't just read. I keep thinking about, in this case, Tanner, the situation. What are those records telling me? What other information might I need? How are those records written? What does that tell me about this case in full? So it's very important not to just see summaries. Now, obviously, if there's a surgeon and there's a surgical summary, that's the summary I get. But in terms of other information, I need to have a hands-on with the information provided, the whole file.
In this particular case where you provided records,
Yes, ma'am.
what kind of records were you provided?
All kinds of records. First of all, I had a lot of law enforcement records. I had videos of Tanner's interrogation. I would say that with an S, interrogations. I had the video, obviously, of this terrible crime. I was given his school records, medical records, his jail records. I had interviews, transcripts with other people that are involved in this case. I just had a voluminous amount of information.
So it sounds like the records that you received were kind of a combination of the state's discovery and the defense's investigation?
Yes, ma'am, I would say that's a good summary.
Why is it important to have both, for both sides?
Because my job is not to take sides, my job is to understand this case in full. And the other issue is that law enforcement records can give me, as a diagnostician, or at least a developmental expert, information about that particular person. So the way the crime is committed, but also how they act toward an interrogation, how they act toward police officers. All of this information is very central in understanding, in this case, Tanner as a whole.
Did you rely solely upon the records themselves?
Of course not.
What else did you do?
Well, I met with Tanner for approximately 12 hours over the course of this investigation. I also met with his mother. I met with his grandmother. I met with his brother. I met with some friends of his. I met with a paternal aunt. I met with one of his special education teachers. I also met with the mother of his child. So I've really had a comprehensive view in person of people's attitudes about Tanner and about their experience with him.
Dr. Bonds, you said you met with Tanner for about 12 hours. During these meetings, did you perform any testing?
That wasn't my job, and no, there was so much testing performed that there was no reason to do that.
Did you review the results of the testing that was performed by other experts in this case?
Of course.
Did you review the reports of other experts in this case?
Yes, ma'am.
I want to talk to you a little bit about the visits that you had with Tanner. You said you visited with him for about 12 hours. How many times did you meet with him?
Well, I met with him, I was supposed to meet with him 3 times, and I had that blocked out. It turns out that I met with him once, and then I met with him on a longer day because we could not get an interview room while I was in town. So I met with him actually on 2 occasions. It was supposed to be 3, but it did not work out that way.
So 2 occasions, but 3 sessions?
Basically, yes.
Okay. And where were you, where did you meet with Tanner?
I met with Tanner at a private interview room near the pod where he's incarcerated. We had privacy. The door was shut. The chairs were comfortable. It was, for a jail setting, very conducive to having a private, interview with any defendant. We could hear each other, see each other. It was fine.
Why is that important?
Because when you're trying to interview a defendant through glass or through one of those telephones, you really cannot get into the intimacy and depths of their life. You cannot do that through a telephone or through a glass barrier. It is a relationship. When I meet with somebody like Tanner, we have to be able to see and hear each other, to actually be in the physical presence of each other, because it is not just an interview for facts. It's my ability to develop a relationship with Tanner or another defendant, and in that relationship, understand how he functions. It's one more very, very important piece of evidence.
Could the fact that there were other people, let me back up and rephrase this. How would the presence of other people in the room outside of the team, how could that affect the validity or the rapport building?
I'm not sure I'm understanding. I mean, we spoke privately. There were guards outside, but they could not see in the room.
Would having the guards inside the room impede your ability to conduct a thorough evaluation?
I would not have conducted an evaluation under those circumstances. There would be no way that private information, not just from a legal perspective, but very sensitive information, no defendant would ever, especially in an incarceration setting, divulge issues of vulnerability or loss or weakness. So I would have probably asked you to find a court order that a guard should not be in there, because I could not conduct an evaluation like that.
How important is it, you mentioned the word rapport, so how important is it to build rapport with the person you're evaluating?
Well, I think it's important to define the word rapport. My job in this is not to become friends with Tanner. My job is to set up an ambiance, an environment where Tanner or other defendants will feel comfortable talking, which means that I try to make it clear that they're accepted by me, that I have a lot of experience, that I'm not here to be criticized or judged, but I'm here to fully be a listening ear to understand. And that, yes, I may ask questions that are going to be painful, that are going to be embarrassing, but I'm hoping that there'll be a level of trust and actual likability between us, that a client or a defendant would divulge such information.
During these evaluations and these interviews that you do, how important is it to get that information from the client?
It's crucial. I mean, if you went to a therapist and you did not feel comfortable with that therapist, you would not divulge your information that is highly personal. You would not feel comfortable with that person. There's a big difference, and I get asked this question a lot, between caring and likability and respect. Okay, I want this to be a respectful relationship. It's fine to tell some jokes sometime, and Tanner sometimes says things that are a little bit off the wall, and that was fine, but it has to be a level of trust. And that it's not a therapeutic relationship, I'm a forensic psychologist, but it has to be that he knows that I am listening and that I will ask questions that will allow him to tell the whole story about himself.
Is that another reason why it's important to have your privacy and not have other people in the room with you while conducting these evaluations?
Absolutely.
Dr. Brahms, let's talk about child development, because that's why we're here, what you were retained to talk about. When we talked about, and when we use the phrase child development, what do we mean by that?
What we're talking about is the trajectory of someone's life. We're talking about what happens, first of all, in the womb, in utero, which obviously is very significant in this case, but also historically. What are the people like that raised a particular person? What histories do they have? Obviously, in this case, both his mother and grandmother had problematic histories. Doesn't make them bad people, but they do. And then we look at stages of development. Every child, whether you live in Fort Worth or you live in, West Africa, goes through similar stages of child development, of where there's certain milestones and certain critical stages of life that children have to go through, hopefully successfully. And then we look at adult outcome and what skills and strengths they had or did not have as a child to have a successful adult outcome. So development is looking at the whole course of someone's life and trying to understand at every point why things were either successful or why they might have been problematic.
You had mentioned in utero. Does that mean that development begins before birth?
Well, it begins genetically as well, but yes, significant issues can occur when there are prenatal complications.
Dr. Brahms, you talked about there being stages of child development. Let's talk about those stages, okay?
That's fine.
What is the first stage of child development?
Well, the first thing a child has to do is they have to be able to attach to others. And in order to attach to others, you have to have a caregiver that is there for them on a consistent basis. It doesn't mean they have to be perfect parents. None of us are perfect people. But it means that they have to respond to their child's needs. It's reciprocity. It is the give and take between a parent and child. And in order to do that, you have to have a parent that is emotionally and psychologically available without their own problems to actually respond to what a child needs. And it's very simple. A mother needs to be able to touch the child's face, and then the child touches the mother's face. The mother smiles at the child smiles back at the mother. But to do that, you have to be consistent, and you have to have the ability and knowledge to do that to an infant. When those things do not happen, with a regular child, not somebody who has a neurodevelopmental disability, when that doesn't happen, the child becomes very agitated. They cry a lot. They scream. Because the parent is not there to modulate their emotions. When an infant knows that there's a caregiver and the world will respond, the purpose of parenting in this first year is to teach a child that the world will respond to them and that they don't have to go to desperate measures to get the world to respond to them. That world will be responsive. So that first period of attachment is significant as a building block for the rest of someone's life.
Dr. Baum mentioned neurodevelopmental disorders. How can a neurodevelopmental disorder affect the development of a child?
Well, profoundly. I mean, I know back in the mid-70s I was doing research on how children who were not, we call it biobehaviorally regulated, how that affects not just attachment, but it also affects the rest of the development of their life. So when we have a neurodevelopmental disability, one of the impairments is the ability to self-regulate. Now, Ms. Anderson, in the olden days, okay, even more olden days than me, okay, you were able to do evaluations on infants, and they had a pinprick experiment, where you take newborns and you prick their heel just a little bit with a little needle. Some children didn't even notice it. Some children cried, but then they put their hand in their mouth and self-soothe. Soothing is not something that people with neurodevelopmental disabilities do. Tanner has never self-soothed except in very immature ways. Some children will just cry and cry and cry. So much of this is related to mental disabilities do. Soothing is not something that people with neurodevelopmental disabilities do. Tanner has never self-soothed except in very immature ways. Some children will just cry and cry and cry. So much of this is related to some of it's we call temperament, but a lot of it's just basically brain development. So it does matter because a child who is neurologically impaired is going to have a harder time when that comfort and that reciprocity is not there because they can't comfort themselves.
So how important is it to look, let me ask this, are interventions available for children?
Oh, absolutely.
How important is it to have an intervention as quickly as possible or as soon as possible?
Well, I don't want to be
Hello there.
unpolite, but it's not
Hi there,
an
guys.
intervention. It's a course of interventions.
Thanks
It's
for
a
hanging with me.
multimodal intervention. So first of all, the timing is extremely important. it is important to start as soon as you see developmental differences or behavioral differences in a child. In many states, most states, there are infant programs where people come into the house, professionals come into the house, and educate the caregivers about how to set up the best possible environment for that child. But what we do know in terms of early intervention with neurological disabilities, neurodevelopmental disabilities, that if there is not intensive intervention by about age 6, that child is far behind the 8 ball. That the types of skills, attention, self-regulation, socialization, attending to the environment, all of those issues need to be addressed well before a child starts to go into stages of development where those skills are absolutely mandatory. So if you do not have intervention early, and that would be occupational therapy, counseling for the parents or parent guidance, educational issues, there's a lot of interventions. If you don't have that early on, everything snowballs because that child doesn't have the basic, we used to call it learning to learn skills. The skills that you have to learn in this world, to acquire information, to control your behavior, all of those things. If you don't have that by a certain time, your adaptation and your coping skills are going to be ineffective.
You mentioned the term multimodal. What does that mean?
Well, it's a fancy word, but what multimodal means is that you have interventions not just in one area, but in many areas, because neurodevelopmental issues are pervasive. And what we mean by pervasive, it's not just a learning disability. You know, I have friends who actually became attorneys and doctors, and they had a learning disability, and they got reading help, or they got whatever they needed, and they went on with their lives. And some of them, they listen to audiobooks now because they don't like to read that much, but they still become lawyers or doctors. That's a learning disability. What we're talking about, and I know this jury has heard this forever, but we're talking about deficits that are pervasive. They're in the frontal lobe. They're in the limbic system. They affect the way that somebody perceives and interacts with the world. So there's language deficits. There are occupational deficits in terms of learning to learn, learning how to pay attention in school, getting other skills, whether that's baseball or handwriting. And then, of course, a very important core is the parenting issue. Those parents, because the people who really intervene emotionally as well as functionally, like teaching children, are the parents. And they are probably as important or more important than any of the other interventions that are available.
You mentioned occupational, you mentioned learning disabilities, you mentioned teachers. What other kinds of interventions are available for children with neurodevelopmental disorders?
Well, there's psychiatric interventions. There's always the option of medication.
Oops.
And this is an important issue because, number one, a majority of children with neurodevelopmental issues have, in quotes, ADHD. They do not pay attention. They are impulsive. It's all of that. You know, we can use whatever diagnostic terms we want to use. I usually don't say ADHD because I think it's part of the whole neurodevelopmental issue, but they have those problems. And you can treat that with a wide variety of medications. The secondary problem comes is that children who live a life with this type of impairment develop secondary diagnoses like depression. That's certainly true for Tanner. So we have to look carefully at controlling this, or at least remediating, addressing those secondary diagnoses. Because then when you have a neurodevelopmental disability or impairment on top of a secondary problem that's major, now the problem, it's not just additive, it's interactive.
What do you mean by not just additive, but interactive?
Because what happens with this group of neurodiverse people, especially those, here comes another clinical term that we call level 1, higher functioning people with a normal IQ like Tanner, is they tend to get overlooked. And what happens is they're oddities. They're oddities in their family, they're oddities in the world, and they develop secondary diagnoses like depression. And then the more depressed they get, the less they function well in other areas. And when they function less well, then they become more depressed. They turn to drugs sometimes. Substance abuse is common in this population, especially these higher level functioning people, because they are not out there. Everyone expects things from them that they can't do. And so they try to mimic what they can do, but they can't do it. and everything snowballs. And so these are serious issues, both in terms of medication and other interventions.
Dr. Burrows, I want to take you back to the stages of development. You had mentioned is some of the stages also where children start learning how to explore the world around them?
Yes, after a child hopefully becomes healthily attached to the world, there's a stage we call autonomy. And autonomy is, anybody who's had a toddler is going to understand autonomy. You don't need a lecture about this. Children, let's say 3 years old, 4 years old, young, toddlers, a little bit of both, will go out to the world and explore. And who do they come back to? They come back to their mommy or daddy. And their mommy and daddy tells them how to explore the world safely. If you want to look at a flower, you go look at a flower in the garden, but you don't rip it up. And you get compliments from your mom. You went and smelled that flower, but you didn't take that flower out of the ground. That is really grown up on your part. And when the child comes back to the parents for that compliment, and they get a hug, then they try to explore something else. So in that stage of autonomy, which is sort of toddlerhood, preschool, they start to learn how to deal with the world with their emotions being controlled and with their behavior being controlled, because there's a solid parental figure, a solid caregiving figure who is there to guide their behavior and give them that feedback and that reinforcement, that guidance. So when they go out to the world, their behavior is controlled. They can look at their environment, they can enjoy their environment, and they get attention. And I don't mean spoiled attention, but they get attention from a caregiver that they are able to be the big boy or big girl and do what has to be done to start to be part of this larger world around us.
What happens if you don't have that kind of solid parent to help you during this stage?
And what happens if you also have a neurodevelopmental disability? I mean, those things are going together in this case. What happens is children who do not have that guidance do not know really how to control themselves. Children who are neurodevelopmentally more normal may have less trouble doing those things. But when you have this hyperactivity and this impulsiveness and this generally agitated state, and when you have families who can't give you what they need, then your ability to be able to go out in the world and act in an appropriate manner and not be afraid or not be overly inappropriate, that is compromised.
And so in cases where you have a solid parental figure that can help navigate that aspect of child development, is it easier for a child with neurodevelopmental disorders or issues to succeed?
Well, let me phrase that the opposite way. Is that when a child with neurodevelopmental differences does not have steadiness, when they're moving all the time, for example, if their parent is on drugs a lot, if there's different people in the house, if they have different caregivers, they're getting the opposite of what they need. Because a child with these disabilities needs predictability and stability and responsiveness. So predictability, stability, responsiveness. That is what is going to modify their neurological damage. Now, all children need that, Ms. Anderson. I'm not saying that we should let other children just do what they want, but in terms of pervasive developmental issues, it's very important to have that stability, that predictability, and that responsiveness. If you don't have that, the brain does not have a way to modify. I'm not saying heal. I'm saying to modify and have that child have the ability to use all of their ability and their skills to have a more adequate adjustment and successful adjustment.
Hang on just a minute. We have a juror who has requested to take a short break. So let's take 10 minutes and we'll come right back here, okay?
Yeah, she's talking about some of the
Right now, it's
or just the lots of it.
You know, I put people and
it filled around paper. I think it was first one.
They have an attempted way to stick up the paper.
It's quite old.
We're talking early on, no. It got a little bit better later, but no, in his early years, he did not have predictability or stability.
What about responsiveness?
Minimal.
And how can the lack of predictability, stability, and responsiveness impact a child like Tanner with not just one neurodevelopmental disorder, but he also, been diagnosed with autism, been diagnosed with fetal alcohol spectrum disorder, and other issues? And how does,
We're talking about multiple negative effects. So when you think about what Tanner did not have in terms of the family structure and stability that he should have had, what happens to any child, not just Tanner, is that your ability to get what you need in an adaptive way becomes very limited. There's a lot of attention seeking, whether that is acting out in some ways. Like I know that he tried to have lit a field on fire. I don't think necessarily on purpose, but he did things that were not smart things to do. Children with neurodevelopmental disabilities also do what's called telling tall tales. They tend to exaggerate. They tend to say things because they want to be something that they're not, because they're not getting that sense of self-worth from a family that cannot respond adequately to them. They also tend to find themselves absorbed in fantasy, because fantasy is much better than the reality that they have. And for Tanner, it's an interesting situation, because most of the cases I get are where there's profound abuse. Most of my cases, whether they're capital cases or other cases, these are children that are beaten, they're hungry all the time. There's obvious abuse. The thing with Tanner and his family is the deprivations were smaller. They were subtle. They were mom being incarcerated, not being there. He never knew. He told me he never knew where his mother would be. She might be on the streets. She might be incarcerated, or she might be home, nodding down in the bathroom for him to find. So, in terms of the way that he looked at the world, was not in a stable, predictable way. And as such, his behavior was not predictable. Part of having autism or fetal alcohol syndrome or being on that spectrum is not being able to look at cause and effect. In his family, people really didn't talk a lot about cause and effect. His mother did what she wanted to do, and I don't dislike his mother, Melissa, at all, but she has never been able to get her life together, much be able to parent anybody, much less somebody with a pervasive impairment. So when we look at this lack of predictability, it's hard enough for, in quotes, a regular child, but it's much harder when your brain cannot make sense of the world around you to begin with. So what makes this situation with Tanner so important to understand is that we're looking at subtleties. We're looking at brain impairment. We're not looking at gross abuse, but we're looking at abandonment, being babysat by a 10-year-old, not knowing where your mother is, having a father who doesn't care about you, being with a, in quote, stepfather who's a meth addict himself. There's all of these things that it'd be so easy for me to sit here and say, well, you know, he was beaten every day and he was locked in the closet. That is not true. What happened in this case is that his brain was neglected. This is a case of brain neglect. It's not a case of abuse. But in that way, in all 3-4 years that I've done this, that is abusive. It is a neglect of what gives somebody the opportunity to develop to be a fully functioning adult.
Dr. Barnes, let's talk some more about the stages of development.
Certainly.
After a child learns autonomy and begins to explore their world, what happens next?
Well, the next stage that all children confront is mastery. When you start entering the elementary school age years, you have to learn how to master the environment. Some of that is reading and writing, because from an educational perspective, you learn more basics between first and third grade than you do for the rest of your life. You're learning how to read. You're learning what mathematical principles are. It's the basis. Very important years. But you're also mastering your abilities to be socialized. You're mastering the ability to be part of the larger world around you. That is basically what kindergarten and first grade is about. And yes, it's about ABCs, it's about learning numbers, but it's about how you learn to be in the larger social world. to hang up your coat, to put your boots in a locker, to sit there with floor time and be with your friends, to learn how to interact with people, to be quiet when you need to be quiet, to ask questions that are appropriate. I mean, we know how many little kindergartners say inappropriate things. We've all had kindergartners. They say things that it's because they're kindergartners. And we teach them in a loving way why that would be appropriate or not appropriate. Tanner, in reality, as an adult, doesn't have much of that. Sometimes when I talk to Tanner,
As
I
an
feel like
adult, though?
that this is something that, if it wasn't a capital case, I would use when I teach law school. I mean, it's a typical case of children who have not been able to master their social abilities and master that part of the larger world. And all of us want to master things. Just as an example, I can't
They
take a
haven't
survey
mastered that
in a
shit.
courtroom, but I would imagine that most of us have collected something at age 5, 6, or 7. I know that for me, we used to take our bikes and collect pop bottles and return them for like 2 cents. Some people, I didn't become rich, but it was interesting. Some people collect rocks. Some collect Matchbox cars. Because why do little kids collect? Because that is their world that they can master. These are my Matchbox cars, or these are my rocks, or these are my throwaway Coke bottles. Okay, these are my pieces of glass that I put on my shelf that I found going around my neighborhood. So that sense of mastery
These are my
makes you
cat
feel
turds.
confident because I can do something. I am a little kid and I can do something.
I did it.
And you feel confident.
Guys,
You
I
feel
did
like
it.
the skills. I'm able to do these things. When you talk to people about Tanner, and when you talk to Tanner himself, that sense of mastery was not
Mastery.
there. He was the one who was continually bullied. He was the one who never could do anything right. He was the one that didn't have parents. Probably he had grandma on and off, but he didn't have a family that taught him to be confident and confident. And when you're not taught that, later in life, you act like the age that you never got that at. So there's times when I talk to Tanner, I literally can believe I'm talking to a 6-year-old in terms of inappropriate comments, not sexual ones,
Interesting.
just inappropriate comments, laughing when he shouldn't, blurting things out, all of those things. It's almost as if I'm talking to a big man who is 6 years old.
Dr. Bronze, you mentioned socialization. What do we mean by socialization?
Did this happen
Well,
to
we
me?
all
Is
learn
that why I'm so
about
fucking weird?
values and morals from our teachers, from our parents, sometimes from like Sesame Street, from different places. So the way that you learn about the values of society is 2 ways. One is by direct guidance, like it's important to go to church, okay? That's an important part because you were brought here by God and we need to respect God. That's verbally stated. But then there's what we call vicarious learning. You learn by example. So you learn when your grandmother goes to church and says, that was a great sermon, I feel so much better. And you're listening, you're saying, you know what? This has
Hey there.
value. And my family's values are that we need to respect something higher than us.
How you
And
doing?
whatever religion you want to be. They were good Christians, so whatever you choose to be. But you learn by guidance and you learn by watching. And that is part of development. Now for Tanner, I believe that underneath all of the problems here and this terrible crime, he did learn some things from his grandmother and even from Melissa. Melissa feels terrible at what she did, and she's able to express that. And she was able to express love to him even in her worst, darkest hours. And I've seen her worst, darkest hours, and they're bad. She understands the importance of family. Jackie did everything possible to have a family with really limited resources. Not a lot of education, not a lot of money for sure. She had to deal with Bill. That was not an easy task because he was against things that she tried to do for Tanner. But what he learned is love. He did learn the importance of certain things to make us human. And he learned that because despite all of their problems, there still was that sense of that in the family. And even with Bill, Bill is a tunnel rat. He's a may his memory be blessed, but he was, fought for our country. And he took in Tanner, and it was not done with hatred. He did what he could do, but I believe that they tried their best to have a family. And I believe that in the long run, years later, Tanner wanted and wants the same thing, that he wanted to have a family, even though he had a very dysfunctional partner and very limited abilities cognitively, not intellectually, not in terms of smartness, but in terms of this pervasive developmental disorder. So those are the values that you carry on.
You mentioned guidance and modeling. What happens if you don't get, proper role models, proper guidance,
Well,
proper modeling?
You get it from somewhere. In middle school, you get a lot from your friends. I mean, we all know that middle school is hell, okay? I mean, I don't think I need to tell anybody that, but those years are very, very difficult in terms of developing who you are and understanding who you are. And then we'll talk about that probably sometime about identity. But you get it from other places. Now for Tanner, he started learning things through channels that were not appropriate. He got into heavy metal music. He got into a fantasy life of superheroes, of all of these things that were avoidant, which is so typical for autism. If you go into a fantasy world. And so I think that Tanner developed values that were not his parents' values and were not necessarily the best values because of the environment that he put himself in. Because he was socially limited, he wasn't going to be a typical person's best friend. They didn't want him as best friend. And he needed to find some way to understand the world. And I don't believe he did that in the most pro-social, adequate way. But that is part of his impairment.
Dr. Brahms, you had talked about Tanner's mother and his grandmother. Did you hear the testimony of his grandmother?
Yes, I did.
Did you interview her on your own?
Yes, I did.
When she was here to testify, was she able to tell the full story about how Tanner was raised and about her life?
No, she did not.
Why do you think that is?
I think because his grandmother has a great deal of regret and shame. I think that she has shame because she was sexually abused as a child and has always felt inadequate and dirty and not good about herself. And it's taken her years of prayer and counseling to try to get over this. She feels terrible that her daughter became a drug addict, a real drug addict, and that she could not do anything to stop that. And she feels inadequate because she did not give Tanner and could not give her what he needed. She did not want to talk about what she went through with her daughter. It's incredibly embarrassing to sit here in front of a court and state that I was a failure as a mother, that my daughter really is markedly dysfunctional. It's hard, it's shameful. And she's a sensitive woman who truly has love in her heart for her child and for her grandchild. And she's disabled and she's in a wheelchair. And I think this, in my view, having spent hours with her, this was probably the hardest thing she's ever done.
Do you believe that Jackie possessed the desire in her heart to do everything that she could for her grandson?
Without a doubt.
Did she possess the ability to do those things?
Very limited.
And what do you feel hampered her ability to give the stability and predictability that was necessary in the home?
Well, first of all, she had a lot on her hands. She had Melissa, the mom, in and out of the house with drug problems. She was trying to give her money. She had no money of her own, little money of her own, Social Security, whatever. There were always financial problems. Her husband, Bill, was not supportive. And she is not a highly sophisticated woman. She's a fairly kind, I like Jackie, you can't help but like her, but she's not a sophisticated woman. And when they got in-home help for his autism, she took it very concretely. I spoke to Jackie. She was very concrete. She doesn't see the bigger picture of what the problems are from a neurological or developmental perspective certainly with Tanner. She just didn't have the tools. This is a woman who worked at Albertsons. She was a barber. She goes to church. She's not somebody who is well-versed in child development. And she's had a very, very hard road to get her to where she was when Tanner came into her house.
You had mentioned also that some of the socialization happens in school.
That's correct.
How does that impact the development of the child?
Well, Tanner, one develops a sense of confidence and confidence in themselves when their peers care about them and when they feel that they fit in. And Tanner has told me in many different ways that starting early on, that he's an alien. I don't mean a real alien, this is not a psychotic delusion. I mean an alien that he is somehow in this world, but does not have the skills that, in quotes, humans have. In his own fantasy way, he sees himself sort of like a robot when he was a little kid, like a robot in school trying to be a human being. Which is, if I ever write a book about autism, should be the title of the book. Because people who have these disabilities have to mimic, they have to cover, they don't know how to do these things on their own. And so, of course, he was bullied. He was painfully bullied. And he never wanted to tell his grandmother much about it because he was embarrassed. But he was bullied terribly through school. So you have someone with autism, and you have someone who's on the fetal alcohol spectrum, who really cannot mimic, everyone's talking about theory of mind, but to understand how he should act, how people perceive him. Tanner, even now, doesn't understand how people perceive him, how the guards in the jail perceive him, how I perceive him. I don't think he even knows how his lawyers perceive him.
I don't understand how people perceive me.
What we have here
is that not normal?
is a child who developmentally, when we talk about mastering the environment,
I might actually be
feeling good about
retarded,
himself,
y'all.
is that he never was part of things socially. And when you're not part of things socially, you don't learn the things about interaction and socialization that your peers are learning because you're not in that group. You're in your own little group.
So when we're talking about socialization and then mastering the environment, with interventions
Man.
have assisted him in going through these stages?
Absolutely. Absolutely.
Even if he had received interventions through all of these
I'm
stages,
socially
would
retarded.
he still have brain impairments?
Of course.
Would they still be pervasive?
Yes.
Would he still need guidance?
Throughout his life.
So how do you reconcile all of this with the fact that he had a job, he knew how to drive a car, he had friends, he went out to the clubs, he had a life? How do you reconcile the need for guidance and the need for intervention with all of the strengths that he has in his life?
Well, we've not talked about this before, so I'd like to just give an example, okay? And then we can talk. I want to tell you, prior to coming to court here, I was hit by the postal man who rear-ended my car. Okay, so nobody was hurt. He got out of the car, and he clearly was neurodivergent. He was twitching, he was crying. He said he looked at the floor and he has a hard time paying attention. He told this to me, I'm a police officer. So what we have there is a Tanner. Okay, we have somebody who has a job. He's a contract postal delivery person, kind of like a contract FedEx person. And he is begging, he's like, don't fire me, don't fire me. He's a grown man, and he's crying. And then his supervisor comes, they come to where the accident was, and they're like, well, we're gonna write you up, and this and that. And he's twitching and twitching, and crying, and it's obviously that he is neurodivergent in some way. Now, he has a job, but he,
That's a fucking problem, lady, that he has a job. What are we doing? For the post office? What? Did they used to like psych eval these people first? Come on, man.
he looked at the floor instead of looking at the road and hit my car and did $9,000 worth of damage. And so what we have here is
That right there. What was that?
he has a job, but he looked at the floor instead of looking at the road and hit my car and did.
That right there. He looked at the floor instead of the road and hit my car, caused $9,000 worth of damage because we wanted a DEI hire, because we wanted to fucking kumbaya, stick butt plugs up each other and be like, ooh, we're so good to the people. We're so good to the people. What are you doing, man? And now, like, she could have died from that. She could have died because some fucking company wanted to hire a retarded person so that they could feel better about themselves. That's crazy, dude. Hey, somebody's here. I thought I was talking to myself again. Miss Bungle, 916. Oh shit, you're probably gone already. Whatever, I still think that
$9,000 worth of damage. And so what we have here is someone who on the surface you can say, well, you're a contract person for the post office. In reality, he is barely able to have the attentional skills to do his job.
Exactly.
So when you
why
do an
are
evaluation,
they
of
doing
someone,
this?
you never just say, what is your job? Or what's going on in your family? Or anything like that. Or what are your hobbies? So you can say to somebody, I have a job doing X, Y, or Z. But to understand their impairments as well as their strengths, you need to have functional details. And by functional details, it's not just do you have a job, but what are your daily routines? How do you master challenges? What do you do about stress? What happens if you have to make a decision about a FedEx route or how you stack dishes? How do you make these decisions? You know, so you could be working as a dishwasher and the dishes are piling up. You have to make an independent decision about how to stack them so they don't fall down. Do you have the problem-solving skills to do that? You can say on paper, I wash dishes at Olive Garden or wherever, at Outback or whatever. You know, I know you work at Outback. But can you really stand the stresses? Can you maintain a pace? Do you have processing speed? Tanner has very low processing speed.
Oh, really?
Things that would be decisions for
That's really interesting, dude. He has very low processing speed. I have very high processing speed. My neurological, I had an IQ test with a neuropsychologist. Took a day and a half. And he told me out of like all the testing he's done, I had the highest processor speed of anybody he'd ever tested. I was deficit in a different test, which is why we stopped the testing because I was fucking freaking out because I was doing so poorly in a different test. Like it was a verbal memory testing, but well, that's where we definitely differ there, Tanner. You're a little slow. I'm a little fast. I'm still like socially challenged when it comes to interacting with people, though. Interesting.
that happen rapidly.
So Tanner's like an average IQ. I'm actually high IQ. So I think I'm like autistic with a decent IQ, possibly. But I've never gotten evaluated for autism. So I don't know. I don't really need to, do I?
Very slowly to him. So when you're looking at functional analysis of somebody, you don't just take things face value. I have a job. You have to, Ms. Anderson, really understand what that entails.
Do you believe that Tanner would have benefited from these early interventions,
Yes, for many reasons.
such as?
Well, he has a normal IQ. I
he's
think
average.
Tanner,
Yeah.
even as a little boy,
Normal
wanted
IQ is
to
actually
interact with
bad.
others. He couldn't have good interactions, but I think he wanted that, and he found, if he had found the right therapist, the right social group, like a training group, a therapy group for kids with neurodevelopmental differences, if he had been taught some basic skills that would have helped him, like how to play.
If he wouldn't have been taken off of Social Security, dude, they took him off of Social Security when he turned into an adult, so he didn't have that income anymore. He probably started hanging out with the wrong fucking people, whatever job he had, who knows. He definitely wasn't getting, since he wasn't getting Social Security, then he wasn't getting any kind of Medicare for mental health, like therapy or anything. Like, dude, honestly, the government kind of fucking let this dude down. Well, kind of. Like, when they shut him off of Social Security, they, I don't know. Seemed like it all started going downhill from there.
T-ball, or how to be successful at something, or how to do artwork, or whatever that may be, we would find that he would feel more confident, that he would start to modulate his behavior. And as you said, Ms. Anderson, it's not going to take away what happened in utero. We're not going to fix someone's brain. This is not brain surgery. This is using every talent and every ability that this young man may have had, and also teaching him to overcome what he doesn't have.
I want to go back to this postal worker that had the rear end, or had the car accident like you.
Yes.
You said that it was obvious that he was neurodivergent, said that it was having switches and whatnot. He didn't kidnap you, did he?
No, he did not.
Obviously, he didn't murder you.
No.
So I guess my
What the
question
hell?
is, you know, do all people with neurodivergent disorders respond to stimulation or overstimulation or situations the same?
No, they don't. But they do respond with certain stress reactions. We do know from purely a neurological basis that people who have autism or neurodivergent with FASD or whatever else, that their ability to plan, and they're always getting themselves digging their hole deeper. The way that I used to talk to people in counseling is you're digging a deeper hole. It's one thing or another. I had a very bright, brighter than Tanner, college and graduate student as a patient. And he would dig himself into holes continually. So he'd do a PowerPoint, and obviously his poor communication skills, and he's very, in quotes, nerdy, and it didn't go well. And so what he then does, he leaves the classroom without anyone asking him a question. So then he gets in trouble with the dean, and then he doesn't agree with the dean tells him. So he goes to the president of the university. This thing is just digging a bigger hole. He should have just not been so hyper-focused on his behavior and what happened and his stress level, and found other ways to cope. There could be a lot of ways of doing that. But so what we find is their behavioral patterns. Not every situation, Ms. Anderson, is the same, but the reactions tend to have a diagnostic and commonality to them, depending on the situation.
What do you mean by diagnostic and commonality?
Well, we know that the brain, all of our brains work in a certain way. We all have to solve problems by looking around the environment, pulling together information, and then our emotional part of our brain has to have some control over the thinking part of our brain, and vice versa, to come out with solutions. When you have damaged those areas, that's going to be very different and difficult. And we know from research, and we know from clinical experience, that people with these disorders who deal with stress generally do not have good reactions. It's avoidance. Tanner has a lot of avoidance. It's meltdowns, which Tanner has had many meltdowns. My mailman was having a meltdown. These are predictable things. So not everyone's going to respond to the same situation in the same way, but the impairments are generally the same.
Dr. Bonds, when you were talking about mastering the environment, you used the phrase competent and confident.
Yes, ma'am.
What did you mean by competent and confident?
Well, in order to be successful in this world, you have some competencies. And to have competencies, you have to be able to follow through on things, pay attention, solve simple problems, not get discombobulated by stress. All of those things and many more are part of having this type of disorder and impairment that Tanner has. And if you don't feel that you're able to master the environment as a child or as an adult, Tanner could not master the world as an adult. He couldn't find the right place to live. He couldn't handle a job. He couldn't handle relationships. Then your feeling confidence about yourself is minimal, if not less than minimal. And you start doing things to make yourself feel better, whether it is resorting to fantasy or thinking you're someone you're not or hoping you are. Whatever that is, it's not a fully formed, competent and confident individual.
Oh, they say he's fantasizing of being a little kid again or something?
Ability to master their environment.
Molested a
Well,
7-year-old?
trauma takes away from everyone's ability. I'd like to use Jackie as an example. I mean, his grandmother has had a lifetime of trauma. And her ability to focus and to think things through, she struggles every single day to do that because of trauma that she's been through. Now, trauma can have both a behavioral impact because of your experiences. So if someone is traumatized, they act out in certain ways, or they become depressed, or whatever that may be. It's somewhat more damaging though, because trauma also causes changes in brain function and brain structure. We know that toxic stress, abandonment, which he's had a lot of abandonment, seeing things that no child should see, that type of thing, all of that impacts not just the way a child responds, but the way their brain responds, and the actual neurochemical changes in their brain and structural changes because of that stress.
You mentioned the term toxic stress. What does that mean?
Well, toxic stress, there's good stress and there's bad stress. So all children grow through stress. All of us grow through stress. So if we have a problem at work and we resolve it, we've learned a lot, we've grown, we're stronger, we're less afraid to make a mistake, we've figured it out, okay? That is a level of stress that we can tolerate, okay? Toxic stress is when we do not have the tools to overcome a stressful or challenging situation. It might be two things. One, it might be that the situation really is insurmountable. There are situations that cause anybody toxic stress, no matter how smart we are, no matter how our brains operate. But stress can become toxic when that person has an impaired brain and then they're faced with challenges that you or I might be able to deal with, but they cannot. And that becomes toxic, especially when they're faced with those stresses over and over and over again. For Tanner, it was never knowing where his mother was, never knowing if she was alive or dead. It wasn't toxic stress like being beaten every day, okay? It was toxic stress that this world is unpredictable and this world is something that I cannot control or master every single day, and he doesn't have the skills that we do.
We're talking about trauma here. Did Tanner share with you some of the more traumatic events in his life?
Yes. Yes, he did.
Let's talk about that. Did he share with you about the time that he himself had been sexually assaulted?
Yes, he did.
What happened?
Well, not surprisingly, it was difficult for Tanner to talk about. What happened is that his mother, they were living on a property that had several homes, and there was a landlord. And as I think I mentioned earlier in my testimony, he was involved in setting a fire and causing some problems on that land. And he had to apologize to the landlord. And his mother, despite her difficulties, had him apologize. And he was sexually assaulted by that landlord at that point in time.
What?
How old was he at the time?
He was
That's
about 10.
You talked about setting fires. Were those fires?
Dude, I was touched by my neighbor, man, but I was an adult already, dude. I was over there working for them, and we went to go get it. Dropped some stuff off at the dump. We were out in the boonies. Dropped stuff off at the dump that we've been like working on the weeding, or I don't remember what it was. And there was like this drive-through place where you could get single beers. And he got us both one beer, and he cracks it while he's driving. I'm like, okay, this is already kind of weird because this is like 2005 or something. You know, I'm like in my mid-20s, dude, and he parks in his driveway, and we're sitting there just having the beer. I'm talking to him, like getting to know him a little bit. And he's like decrepit, arthritic, hunched over type shit. He's like, looks like the Hunchback of Notre Dame. When he walked, he couldn't even lift his head up. This dude was like fucked up from arthritis, dude. It was a trip. He kind of shuffled too, because of it. And like his hands are kind of decrepit. And next thing I know, he's trying to stick one of these hands in my pocket. And then he starts like pushing it further into my pocket. And I'm like, I put my arm in the way. I'm like, what are you doing? He's like, oh, I'm just playing. And I'm like, no. I got out of the truck and I'm like, what the fuck? What the fuck just happened? And I just walk home next door. I live right fucking next door, right? That's why I heard the story made me think of it. And I told my parents, I'm like, dude just tried to put his hand in my pocket to touch my dick. Mom, Dad. And they're like, nah, come on. They thought I was making up shit so I didn't have to work. They thought I was trying to get out of working, dude. And for the longest, they didn't quite believe my story, right? Until they find out from his wife. My mom was working with his wife, and at their business, and she tells her that, like, yeah, back in the day, she called him cheating on her with other men and shit a long time ago. And then also, they would always have high school kids come and help them on the summer. And my mom said that they never came back. They would never come back, dude. And she always thought that was kind of weird. And they put like 2 and 2 together, you know what I'm saying? Like, oh, I didn't even know the fucking dude was gay, man. And when she heard that, she was like, oh shit, he probably really did put his hand in his pocket. He did, dude. I don't like imagine shit like that. Dude, I've had 3 people try to fucking touch my penis. They were like, one is I was at a gay club and I was really drunk, and I understand that one. But one was a nurse, and the other one was that dude. I've had 2 gay people try to touch my dick without even asking me. 2, out of nowhere. It's like, what the fuck? The nurse dude did touch my dick, and the old man tried to. So I have a reason to have feelings, the feelings I feel when I talk about gay people or trannies, the tranny that fucking catfished me and shit, had me kiss them. I got a reason, dude. I'm not just fucking this dude that's like, fuck these people because I fuck them, I'm just some bigot. No. Fuck these people because they be doing some dumb shit out here, man, in these streets. You know what I'm saying? It's like that. Like, I've had some experience in life. But yeah, my parents believe me now on that one, 100%. Because they found out more information. I forget what else they found out. I think there was even more. Okay, Simon, medicine time, medicine time, medicine time. I gotta give it to you, medicine time. There you go, good boy, good boy. Yay, alright. Check, medicine check. Now we gotta go back in there and give then their food. Alright. Yeah, man. Dude, I experienced a lot by the time I was just like 30. By 30, dude, actually by 30, all 3 of those gay incidents had already happened. Yep. Yep, they sure as fuck had. That's the truth. All 3 of those, and then, but it wasn't until 35 that the tranny catfish happened. But that's only because trannies weren't as accepted in the early 2000s as they are now. There weren't as many of them, so it took a while for that one to happen, I guess. You are a woman. You know what I'm saying? They didn't have people telling them that type of shit back then, did they? They didn't have women telling them that, did they? You're as much as a woman as I am. Come on, no. Let's get back now. Or some women will be like, they're more of a woman than me. And they hear that and they're like, oh my God, she's right. I am more of a woman. Because I chose this, she didn't. That makes me more of a woman. Come on, let's go. Come on, food time. Good boy, you're such a good boy. You're getting extra adult food today. You're gonna love it. I hope you love it. Are you starving? Are you starving, baby? Am I no starving, baby? You got kind of fat though right here. You definitely got some like kitty love handles. If Sweet Pea had it her way, she would look like Dom. She'd be all husky. Sweet me. Come on, I gotta open the door. Why are you all around my ankles? Homie. No. Simon's right here, chilling. For no reason. That was a cool camera angle. Alright. The angle of the dangle. Sometimes you gotta let it dangle a little. Can you see him? Oh. Oh, he's excited. Is he excited to get some food? Is he? Show ya, show ya, go get some food. 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 Show ya, get some food. Yay! That's what that was. Alright, who's out here? Please, Trident, be out here. Please, 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 please. Oh no, where's Trident? I'm worried. Trident hasn't been out here all morning. She's normally here. Shiloh's out here, laying in the grass in the front yard near where that food was placed. Oh man. I hope Trident's okay. She might have eaten it. I tell you what, man, if she really disappears, I'm gonna have that food tested. I kept it. Not that that'll do anything as far as getting a prosecution, but I have very strong suspicion that I know who did it. Maybe Trident ate it, but Shiloh didn't. Or maybe Shiloh's better able to handle it because she's younger. But it is unusual for Trident not to show up like this. If she sees the open window, the blind, she'll come over. You didn't eat enough, buddy. Not even near enough, homie. No, come out. You didn't eat enough. You made a mess. You still didn't eat enough. Come on, yeah. Come here. Come here. hell she go? Well, now Shiloh done disappeared on me. What the heck? Shiloh is nowhere to be seen now. She was right there. I mean, it's not really my time yet, is it? Maybe they're keen enough to know that they have another hour or so to eat. Come here, yo. Sawyer, you're supposed to eat, buddy. You just didn't eat hardly anything, man. I don't know what to do, bro. Sure, I'll cover this up and give it to him again. Later, see if he'll eat it. Shit. Man, I wish he would just eat it though. I don't know what to do, dude. He's not eating enough calories. Not the way I'm getting today. See what he's looking like. Because I think it was 8, 9 last time. I didn't write it down apparently. Simon's eating good today. Going on his second can now. And I gave him the stimulant last on Saturday. So I think some days he's good on 2 days, some days he's good on 3 days. Definitely don't need every day full dose. We're talking every 2 or 3 days, 1/3 of a dose maybe. Yeah. I don't know if that made the biggest difference, or if it was just getting his water off of him, like out of his lungs or whatever, out of his inner cavity, or maybe getting his heart rhythm and everything. There's a lot going on with Simon, man. There's no telling what did it, but the appetite stimulant, I think, might also actually be helping with stress levels, because it is actually an antidepressant in humans. It also causes appetite stimulant properties for effects. So maybe it's making him a little happier, but he's still very OCD about the front and rear doors and wanting to see what's going on out there. And I get it though. He wants to look outside, man. He wants to. Out of here. Simon dies. I'm just also thinking about traveling with 3 cats, and I don't know how well Simon would take traveling with all the medications and feeding and. Just thinking about traveling in a U-Haul or something with 3 cats in the passenger seat, it kind of is mind blowing to me. It sounds pretty hard. With lots of stops along the way to stay. Like, I would normally just drive that whole trip probably non-stop. Or one night stay, but with like 3 cats, I'd have had to do it within like 4 days, maybe more. Fuck, especially with Simon, because he needs to pee more, being on diuretics. I'm starting to think about all this, now that I get the loan paid off. Well, at the same time, it saddens me to think that like these cats won't have anybody taking care of them, or at least, I mean, as far as flea medication, ear mite medication. Some of them might not, like some of these cats say like the only meal they get might be the one that I feed them. Some days for sure. Dude, if that guy fucking poisoned Trident, man, I'm gonna be. Oh my god, I really don't want to have to deal with police report and all this shit, dude. The Trident doesn't show back up. Have to send this shit off, that's gonna be a bitch. They might even test it though. Like if she ends up missing and I tell them the story, they might test it for free. Just to see if there's something going on in the neighborhood. That way they'll have it for because with my story, dude, I think there's reason to believe there could be foul play. They're tough. Yeah, I mean, they're tough, dude, and that's, I mean, like Simon has made 2 really long trips, all the way up to Denver, all the way back down, and yeah, that's pretty far. I had another cat that we drove from the Fort Collins area, which is even further north in Colorado, and all the way to San Diego, which is further south, California. When she did that, back and forth trip. Yeah. It's amazing how long they can go without pissing, dude. But at the time, I don't think I was as educated. Like, looking back on it, I should have stopped in more locations for multiple reasons. I think I only stopped. Maybe I did stop at 2 on the way out here. Might have only stopped at 1 though. I didn't realize at the time how that could be doing like kidney damage to him from like too long in a car, not getting fluids. And he wasn't even drinking or eating wet food at the time. So like we would go on those not vacation but moving trips, and he wouldn't drink hardly any water, you know, because he's freaked out from being in this moving truck. And then maybe that's one of the reasons why he wasn't peeing much, but that's not good for his kidneys. Nowadays, now that I have all these cats on wet food, they would definitely need to piss sooner on a road trip. Maybe even every 6 hours, I'd have to stop driving, get them all out in a hotel room. If it's like that, it would probably take 4 or 5 days to get here. If that's the case, I could sightsee a little bit, I guess, on the way. Meet some viewers on the way across the country. There gotta be somebody along that route on the 40. But yeah, I took the that cat food. I took it out last night. I have it up here. Oh yeah, it was already in frame on it. I don't know. It's just right here. This trash bag. I took the cat food. And it's got dirt with it also, but I mean, I think they could test it anyway, but I took it out of the trash yesterday so I can have it. CSI, Long Beach. You know what's ironic about that? CSI Miami was actually filmed in Long Beach. I met Dave Caruso when the redheaded dude that was in Rambo. I met him, got his autograph. He was a cool guy. He was like 2007, 2008 roughly. They would put up stuff on the outsides of buildings that make it look like they were in Miami, downtown Long Beach. And I remember, like, we saw that they were doing filming, and I saw him in his red hair, and I'm like, oh shit, that's like, I don't remember if I knew his name at the time or not, but I was like, that's that famous actor, man. And I was like slyly like recording him or something with my phone, old ass phone. I don't even know. I wonder if I still got that somewhere. But then he like called us over, me and my girlfriend. We had skateboards in our hands too that could be used as weapons. And he was like, he called us over to him and handed us these like pre-signed photos of him. And I think we took I don't know if we took a picture with him or not, but it was cool. Like, he didn't have to do that, you know? Like, he was in between takes doing something. He saw that we were like cheesing, thinking, oh shit, that's a movie star, and he called us over to him. And he had these little things to give us ready to go. What? It'd be nice if you get them harnesses and leash to let them out to stretch. What? The cats harnesses and leashes? Yeah. The thing is, Sawyer is white, and letting him go outside would turn him not white. Same with Simon. Sweet Pea wouldn't be nearly as noticeable, but because I know what it does to them, I know that she'd also be filthy. I'm just not seeing it. So it's kind of like, I don't know, man. I don't want dirty ass cats walking around every day and getting up in dirt, like dirt on everything. Euro trip. Oh, yeah, I doubt that. You would have to, I'd have to get them used to that far in advance, probably, though, by letting them out here on harnesses first. Otherwise, it would be like a doubly traumatic experience for them. Here's a road trip, and here's this weird contraption, and now you're gonna get to finally go outside. No, don't pee. Go pee. Doobie-doo. Oh yeah, I forgot this case is on. God, dude, you got me thinking about moving and shit. I'm like, I'm actually stressing thinking about moving with 3 cats, dude. It's like not really that bad with 1 cat. I've done that multiple times. It's very doable with 1 cat. I'm just thinking with 3 cats, it's gonna be insane, dude. Are they all 3 gonna fucking just start yowling together, or what? Are we gonna have an orchestra of yowling? I don't know, man. All in their separate little yowling cages, yowling compartments.
Let me rephrase that. Was there any indication that those fires were set with the intent to
Do you
burn down a house?
Do you know how loud a cat could yowl inside of a car when they realize that space just is like a sound chamber? Dude, Holy shit, Sweet Pea gets the loudest, dude. You can imagine, because she gets very meowy in here. Or the car, you would think that like she's hurting or something. So I've never had all three of them in the car at the same time, no, but I have had, who have I had? So I think I had Sawyer and Sweet Pea. Who did I have at the same time before? Do y'all remember? I took two of them at the same time at least once. Bro, it all blends together.
House or could cause mass destruction or anything like that.
No, not at all.
What, when you told you the story about the fires, what did you make of the fires?
I felt that I was talking to a young man who was unable to predict cause and effect, and he thought it would be interesting to see what it looked like if some dry brush was burning, and it never occurred to him that that could spread.
I don't believe that. I don't believe that, dude. Did you hear what she just said? That this fucking asshole lit some dry brush on fire because he thought it'd be neat to see the fire, but didn't realize that it could spread. Listen,
Talking to a young man who was unable to predict cause and effect, and he thought it would be interesting to see what it looked like if some dry brush was burning, and it never occurred to him that that could spread.
I don't believe that whatsoever, dude. I'm sorry. No, he's not fucking full retard, lady. That's full retard. To not know cause and effect on a fire and whether or not it's going to spread. What? No. I don't think he could have made it to regular classes if he actually didn't understand how that worked, how fire works. Right? Did he actually just go up to a fucking brush and lit it on fire and like watch it? Are you serious? It'd be one thing if he shot a firework off and he wasn't thinking that that could land and cause a fire somewhere, because a bunch of dumbasses do that every year when they shoot off fireworks all over the world. But going up and intentionally lighting a brush on fire and watching it and then saying, oh, I didn't know it was going to do that. I don't know, man. He might actually be kind of evil. Huh. I don't know, dude. I didn't know about that.
Who has been
happening.
sexually assaulted like Tanner was at such a young age, can that
I think he
cause
was
that-
out. I think he was fucking acting out there and trying to show people, fuck you, like the dude at the fucking the paper products place. I don't think that was a I don't know what I'm doing type situation on that one, dude. No, that's probably like how they tried to like mold it and shape it as they're talking in their little fucking $350 an hour meetings per hour. I said that. I said hour twice. I get it.
either to mimic the type, that same behavior?
Well, I don't think that the research, again, Ms. Anderson, I know you're not a psychologist, but it's not a matter of mimicking
Mr. Anderson.
behavior. It's a matter of when someone is sexually assaulted, there's a lot of questions raised in that person about their sexual competence, about why they were picked upon to be abused. And because of this, not everybody by far, they get into situations where they're exploring their sexuality and where they're trying to get some issues worked out about that. So I think what sexual abuse does primarily is put somebody in a position where they're unsure of their own sexuality, which can lead to many, many different outcomes. Okay, it can lead to sexual exploration. It can lead to depression. It certainly did for Tanner. He had some traumatic symptoms after that. Even now, it's in his memory. I mean, not diagnosed with PTSD, but I would say that at the time he had many trauma symptoms that sort of have remediated over time. But the actual event is something that he clearly does not get out of his mind. That is something that is still very troubling.
What actually happened?
Is it what we talk about?
Very.
I'd like to know what actually happened.
You had mentioned earlier about identity.
Yes.
You know what I'm saying? Because, dude, I know that like a lot of the people probably think that he's just trying to use that as an excuse. But why is it there's such a high prevalence of people that got abused that do the abuse? There needs to be fucking research done on that to find out what breaks in the brain. Is there something? Is there somehow a extreme chemical imbalance, a shift that happens because of that? And like why? And why did Muhammad have sex with children? And like, did he know about the shift? Were they trying to turn their people pedos or something? Muhammad was a known pedo. What about Mahatma Gandhi? Supposedly he used to fucking lay with little girls to prove that he wasn't a sexual deviant to himself or some shit. He wouldn't have sex with them. He would just lay naked with them. Anybody know anything about that? What's really fucking going on?
Tell us about that stage of development.
Well, during those middle school years and beyond, one has to establish who you are as a person. What am I? Am I a smart person? Am I good at certain things? What am I going to be when I grow up, so to speak? Much more than I want to be a fireman. We're not talking about a 6-year-old. We're talking about forming an identity that will lead into adulthood. So when Tanner was in those stages, most healthy children in healthy situations have positive experiences. They're not bullied. They don't have home life problems. And they're able to have experiences that mold who they would be. For Tanner, he did not have those positive experiences. His identity started being formed as that alien, that person that can't really get along, who has to mimic, who doesn't really understand the social world around him. And when he started to develop an identity, what was left for him? I mean, what really was left for Tanner? Well, it was the odd things. It was the outlier things. It was the rock music and the heavy metal many people don't listen to. It was watching Marvel movies 20 times. It was Dragon Ball Z.
Yo, that right there is a fucking red flag for me. Anybody that ever tells me like that they are an extreme comic book movie fan, like if they like all of, like she was just talking about, they're all up into that shit. Yo, no, I'm sorry, I gotta go. You have a good one, man.
A cartoon that I still can't understand, by the way. But it was all these things that created his own identity. But it wasn't an identity that was the typical identity of I'm in 4-H.
It's like that fucking fat ass Royce Miller. That dude's just like that on YouTube. He's all into that fantasyful type shit. Meanwhile, in the real world, he's avoiding the elephant in the room of his morbid obesity that's killing him, and he just keeps fucking stuffing his face like, hey, you guys want to talk about Spider-Man today? The fuck? Come on, bro. You guys snap out of it.
I'm in the school play, I play basketball, I do these things. At that point, he was a church-going kid, and he could not sustain that. Now, I know later on, he's become much more serious about the values his grandmother taught him about religion. But at that point in time, he couldn't get along with the youth group there. I mean, I think he played some kind of musical instrument, but he shared, he's always an outsider. So he went to activities that made him comfortable because he found people like himself.
How would a person who has level 1 autism, how would that impact their ability to navigate this developmental stage?
It would be very difficult. I think having, I really don't like talking so much diagnostically. Level 1 of autism, to me, is worse than more serious autism. Because, and I know that sounds probably off the wall here, but I do mean that to some degree as a professional. Because if you are more impaired, people see that you're impaired, and people either have empathy or you get special services or whatever. But it's the people in level 1 that are the ones that are hidden figures. Nobody sees they see the superficial. They see someone who has a job or this or that and goes to
I mean,
school.
that's true, though.
And graduates high
She
school.
had a point.
Not greatly. I think he was like 350 out of 355 or something, but he graduated. Okay?
Damn.
And so what the issue here is for Tanner
I didn't
is that
graduate.
he didn't stick out. He stuck out as odd.
I didn't graduate. I got my GD though at 17.
But in terms of the services that he needed, like in high school,
Gang gang.
he had minimal services because people did not understand the depths of his impairment. They saw a kind of pain in the butt, goofy guy who was sort of attached to school, who had his social issues, but nobody really understood the limitations that he encountered every day.
So it sounds like when we're talking about level one, people tend to focus on the strengths and not the deficits.
Or they just don't see the deficits, or they see these youngsters, teenagers, adults too, as just odd or sort of bothersome or not really doing the job they should do. But I don't think that it comes out as a impairment to the degree that it really is like to have level 1 autism. That is a pervasive developmental disorder, regardless of what clinical level we put it at. I don't care if you give him level 2 or 3 or 100. Tanner is Tanner. Tanner has these impairments, and he has struggled with them without very much help. I mean, he had Miss Weaver, who's a lovely person, but the type of intense, continual intervention that he needed till adulthood and through, he did not have.
You had talked about
You can dance to anything, man.
his feelings and that he was gravitating towards outlier things.
Yes, he did, for sure.
So when someone sees themselves as an outsider or someone who just doesn't fit in, can their own, I guess, self-identity impact how other, I mean, it's a self-fulfilling prophecy, I guess.
It is. It's a self-fulfilling prophecy. I mean, Tanner was, I'm going to say this, less capable than his peers that he chose. He chose outliers. He had 2 friends that I talked to.
I did
who
the
were
same shit.
Punk rock, used drugs. They finally had a life and they have a couple children and they're very nice people. To this day, they look at Tanner
I didn't
as
diddle no
their-
kid, though.
as they put it, their disabled little brother. They know that he doesn't have the judgment, that he doesn't have the social skills.
Right.
So what we have here is Tanner went to a group of people, especially his bandmates, who were into all of this fantasy and all of this stuff. And even then, he told me he was kicked out of 10 bands. He does not know why he was kicked out. He has no idea how inappropriately he was from a social perspective. He told me some of the things he did. And they weren't dangerous. They were rude. They were comments he should not have made. There were things he did that were remarkably immature. And even those guys who were in that outlier group thought he was more of an outlier.
So how would having someone in the home that form this identity affect their ability to form that identity?
Say that again more clearly if you don't mind.
I don't know if I can.
Okay.
I'll begin though. How important is it for a child to have someone to encourage them in the home, Dean?
Well, when you talk about adulthood and you talk about going into adulthood, you need to have the resources to become an adult. And I think that's kind of what you're getting at, in a way. Yes, I think you're talking about what do you need to become an adult. Well, first of all, you need to have a brain that functions well, because adulthood has complicated challenges, really complex challenges. Whether you go to college, whether you get a job, you have to have the ability to plan, to problem solve, to pay attention, to deal with stress, to be able to control yourself behaviorally, not have meltdowns, all of that. But then you need to have a home that gives you some type of support and guidance. It doesn't matter, Ms. Anderson, if they're rich or poor. I have families that are not wealthy at all, and that their son or daughter knows that if they need $20 for gas, you can go to mom. They also know if they're having a problem with a girlfriend, they can go to mom or dad. And as you have that support, you're slowly able to start to acquire those adult skills and independence, that adult independence that we all need. But you
I
can't
definitely
just
had more
go
support
from
in that
being
regard than he
a
did.
teenager like he was
For
with these
sure.
pervasive impairments, and all of a sudden, he's in the adult world. There was like no transition for him, and he did not have the resources in his home or his cognitive neurological resources to really function as an adult. And I think we all see this over the testimony that's been given.
But I moved
When
out
we
at
talk
17.
about,
That was interesting.
adulthood and independence, I've heard the phrase fully integrated. What does it mean to be fully integrated?
It means that a person is able to accept their positive and negatives, that they're able to see themselves as a complex person, and they do not have to shut off certain parts of themselves. So if I make a mistake, and we all make lots of mistakes, if I do something that, let's say, is rude to Miss Anderson, okay? I wouldn't do that, but let's say I did. I made a comment I shouldn't make or whatever. That is still part of me, and I can analyze that that is it. I was either stressed, or there was something in my childhood that you reminded me of that I got upset about, or I was just in a bad mood. But I also can take it, I can also understand that I don't have to kick that apart and say, oh, that's just somebody else doing that. That's not really who I am. Of course it's who I am. It is who I am. I did it. I said those things. But when you're fully integrated, you're able to understand and accept and pull together all parts of yourself. And that's a challenge. That is a developmental challenge, and it takes time to do, and some people never get to that point.
Was Tanner ever
What
able to get to that point?
People
No, he was not.
don't get to that point in the world.
How important is it to have coping skills in order to help yourself to fully integrate?
Well, the coping skills mean that if you do something wrong, like if I was insulting to you, I'm not going to deny it.
Judge?
I'm not going to make
That's
up
your first warning.
untruths, fanciful untruths that, for instance, like, you
No
know,
coffee.
I was in Uber going to court and the guy really scared me, and then I saw somebody who I didn't like, and then I was in the elevator and I got stuck, and that's why I'm in a bad mood. These are fanciful things. It's not true. The reality is I was wrong to talk to you the way that I did, and I'm able to accept that as part of myself. But when you are on, either have signs of FASD, where many people on the spectrum have a very hard time just coming to grips with what is going on in the here and now, as well as autism, with the theory of mind issues, these are difficult things to do. So Tanner has a double, if not triple whammy. He's got difficulties in his neurological functioning from FASD and from autism, but he also has a family, as good-hearted as they may have tried to be, who just were unable to give him the guidance and daily reinforcement about how to.
You mentioned earlier about avoidance. Is that how Tanner copes with things?
That is Tanner's main way of coping, is he avoids. He avoids through music. When he's stressed, he plays music. He avoids through watching the same Marvel movie 20 times. He avoids by watching Dragon Ball Z 100 times. He avoids by smoking weed. He avoids in a lot of ways. He avoids, and it doesn't work because he's still anxious and he's still depressed.
Is he a chronic masturbator?
He doesn't.
How does he cope with stressors?
He doesn't.
Wait,
How does he cope with
wait. He's probably, why does she talk about his chronic masturbation? Would that hurt him? That probably hurt. I wonder if the prosecution will ask him about it. Did he tell you about his chronic masturbation?
agreements?
Not well. He leaves. He's not an arguer. He can't
Really?
do the social.
Did you ask him what he thinks about when he masturbates, doctor? Well, did you? Why didn't you?
You know, he
You
can
think that was
argue, but
important?
it's ineffectual.
How does he cope with adult responsibilities?
Very poorly.
And how is he able to manage multiple demands?
No, that multiple demands for anyone with his limitations are difficult, but for Tanner, they are really destructive. When he has multiple demands, especially in stressful situations like not having money, not having a car, having to go places, having to work, he
turns full
completely melts
retard.
down. It might not be crying, although I will tell you, as an adult, he's banged his head many times. He's self-destructive. He hits himself. He does things with a lot of self-hatred, a lot of meltdowns, all of this. But no, he does not.
The last thing I did was punch a wall. Never again, dude. A month of a cast on your hand, on your arm. It's so fucking itchy, dude. It's so itchy. Do you understand how itchy it is? And then if you're a side sleeper and you like to put that hand underneath the pillow, oh no, now you're putting a fucking rock under the pillow. That shit ain't fucking right. That shit ain't fucking right, and it itches. Did I mention that? Fucking. Did you know that you can break your hand around here? You gotta get a cast that goes up the fucking hair. Yo, don't do it. Don't do it, folks. It ain't worth it. Don't do it. Don't ever punch a wall.
I handle complex situations, multiple demands, stress, in any way comparable to a regular adult.
Talking about the avoidance, you mentioned that he avoided by going to music.
That was a major way that he coped, yes.
And it
So how do you,
stinks
again,
so
reconcile
bad.
the,
Dude, it starts stinking after like the first like week and a half of having the cast on. You can like just smell like where the cast at. It's starting to reek, dude. They have these new casts though. Have you seen this shit? It's like, it looks like hexagonal plastic material that hardens around the arm, and it's like, you can see like your skin and stuff. I don't know how much those are used now, but pretty sweet looking.
type of music that he has, that he loves, the screamo and the heavy metal and
Yes.
whatnot, with the fact that so many people with autism have issues with noise.
Yes.
Let's do a
But
cat
for
rider.
Tanner, this music, which I made myself somewhat familiar with, is noise, but it's really for him white noise. Children on this, adults too, who have these disorders do very well in environments where like a fan is whirring, or there's these white noise machines. Many of my clients, the parents would buy them these white noise machines where it just blocks out other sounds. But for Tanner, he knows the lyrics of every song. He has that control. He likes the loudness. It sorts out it sort of avoids the thoughts in his head. He completely goes into the music. And for
At least
him,
two.
it's calming more than open.
And let's talk about the interrogations.
Okay.
Did you see all of the interrogation videos?
Yes, ma'am, I did.
Now, from a clinical point of view, what were your impressions of these interrogation videos?
From a purely clinical point of view, Ms. Anderson, if I was not involved in this case and someone just clinically gave me this and said, what would you think about that person? If I knew nothing except the video, okay, and this was a test of some kind, I would definitely say that person was on the autism spectrum, without a doubt.
Why is that?
Because he had no ability to understand what the police officers and the Texas Ranger was trying to do, how he presented to them,
What?
why the comments he made would be taken so badly. I mean, his inappropriate comments about only wanting to see his son and about Christmas, among many other comments. He had no idea how that would be taken. He didn't understand how fanciful his lies were, if you want to call them lies. They're misinformation for sure. He had no ability to reflect.
If you want to call
You
them
could
lies.
see in him the difficulty in communicating
Right.
anything but these very basic, immediate needs, and not being able to see the bigger picture of what was going on in those interrogations. It's just obvious from a clinical perspective.
What about from a forensic perspective? What
Well-
were your impressions of the videos from a forensic side?
I think in his own incapable way, he was trying to not tell the truth to the officers, but he admitted what happened to Athena. He did say that he was responsible for her death. He did say that. But then he tries to either delay the inevitable, try to come up with some type of excuse or something about what happened. I mean, you have someone here who's just incapable. This was not a criminally minded lying. This was some type of ineffective storytelling that anybody who would interview him would know would not be true.
How is this not a manipulation?
It's a sign of autism. It's a sign of what he has on. What is he manipulating? He admitted what he did. Eventually, I hate to talk about this, it's very painful to talk about, but they eventually found it in his body. Eventually, he got them into the area. What is he getting from that manipulation? What is he gaining? He's gaining nothing. There's nothing to gain. My question watching the interrogation was, is this a fantasy? Is this him trying to like be in Law and Order? Is this Tanner's just way that you're supposed to talk to the law enforcement like this? It seemed almost like he was movie scripting, like this was something that if you're caught, this is how you act. But it had no end. There was no purpose to what he was doing.
So when you're talking about manipulation, generally does the manipulation have a purpose to the end?
It has gain generally at the end, whatever you're manipulating for.
And in this particular case, there was no gain at the end?
I didn't see any gain at the end. What I saw was someone struggling to make sense about what happened and struggling to understand, which he did not, what is going to happen to him. To him, at that point, it was just let me go home and see my son. I don't think that he understood the gravity of what was going on or how the police and law enforcement, those Texas Rangers, would perceive him.
During your evaluation, did you discuss these interrogations with Hannah?
To some degree, yes.
And what was his reaction when you started challenging him on these interrogations?
He went back to the fact that nobody understood how much it was Christmas and he wanted to see his child. He told me that he did not really remember everything that happened. He told me basically he did not understand the gravity of the situation.
In these videos, we see Tanner take on the persona of Zero.
I know.
Does taking on this persona make any sense to you?
It makes diagnostic sense, absolutely.
Why is that?
Because you see this in a lot of people like Tanner. That's the lack of integration, the lack of integration. He cannot say, I did this. He said it happened, okay? He said Zero was involved in this. Zero. Is there really a Zero? I don't think that there's a Zero that walks around with him all the time. Is it something that he has a Zero in his life that he turns to when things get bad, that he talks to, that's sort of a part of him that's not integrated? Yes. And I think in this very stressful situation, when you have to talk about something that is so horrendous, I believe that this was his autistic way of being able to talk to law enforcement. That Tanner Horner himself is not integrated. Tanner could not do this. He had to put some of this aside. I don't think that this is a fantasy. I think this is the same thing as when your 4-year-old breaks something and you ask them if they broke it, they have an imaginary friend or say somebody else did that. You know, this little guy did this. This is the developmental fixation that we have with Tanner. So, I don't think there's no such thing anymore as multiple personality. I don't think he has dissociative disorder. I don't think that he really has another person. I think you're looking at someone who is remarkably impaired and extremely immature for adulthood.
Remarkably. Stu Tim's almost eaten an entire second can before the 11 o'clock pickup. I put way too much water in Fluffy's food. Oh well. So we got lots of water this morning. For pee-pee. Oh, sorry baby. But she doesn't hate me for it. Maybe she'll like it. Alright, I need to do this litter box in here so that I can throw it out with the trash. Hey, you two. Hey, kitties. Go down. Hi, no. And Sawyer, you are so freaking persistent. Sweetie, Sawyer. No. Dude, and now I don't see. Oh, no, they're both out here. Trey's breathing kind of fast, but they're both out here. Okay. That's what I did with their food. With his food, I just aluminum foiled it up for now, and then I'll bust it out a little bit later and hope that he actually eats it. That'd be sweet. What? You got my toothpick. Yeah, my toothpick. You jelly girl. You little rascals. You're a little rascal. Hi. You wanna watch today? See if you get to watch it. Watch out. Oh no. We got our first clump. Our first clump of the day. Sawyer, come here. Come on. He just stops walking. Sawyer, no. Sawyer. What? Sawyer, come on, man. I don't want to put this in your head. What are you doing? Bro, you're acting crazy. Just goes back down. No. You okay? Oh, see? Oh my goodness. See, I couldn't tell you that was where your foot was. Hey. No more biting me. Stop it. Go away. Here, you want this? Go like that. Hello there, buddy. Get in a front row seat. Okay, put it in here. What do you think about that? Here, I'm going to do another one. Boop. Oh, so look at this. Sorry, look at this one. Hey, look at this one. Look at that one, Sawyer. Look at that one. Boop. Super, you're missing the show. Come here. Guys, this is getting heavy. So. Boop. Boop. Sawyer, the show's not over. Oh, it is. How did you know it was all in there already? He got it before I even knew. He was like, yeah, nope, there's one last piece. Look, you were wrong. Boop. Yeah, there was one last piece. Close though, buddy. All over the carpet. What's this? Yeah, baby. Do you think I need a vacuum? Hey. Dude, stop it. Please. I have things to do. So creepy. Please move. Please move a little. Guys. Catch of the day. Dude. Alright, now get this ready. I'll show you on his box too. Dude. I'm not sure this is a bunch now. sweet. Oh, baby. Hey, baby. No, 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 no. What are you doing? What do you think you're doing? Do you know what's going on here? Do 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 do. Come here, man. Even yours gets that straightened out, Sawyer. Whoa, look at all that poop. It's so much always mostly poop. Dude, he's playing with the shadow over here. Man, this thing is ridiculous. Check. 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 How many cats we got? Two cats. Two cats. Front yard. Check. Hey, Sweepy, can you not? Can you not? Can you both of you not right now? Man, come on, bro. I'm just trying to get this shit checked off, y'all. Check. Check. Yeah, you know. I'm running out of time as well. I'm trying to. Let's do it. Alright. You got to, dude, she has the ability to fucking jump scare me from the other room, dude, with her fucking screeching. I feel like I'm stepping on her out here almost. It's so loud. Pepper spray, check.
Yes, this is Vicky Watkins. Hi, Lucy.
5 cats fed outdoors, 3 cats fed indoors. And they're watered too, you know what I mean? That matters. That actually matters tremendously, dude. Them getting water the way they are in this wet food, it lowers the chances that they will drink out of a stagnant water bottle and get ill from that. You know, lowers it dramatically, especially if it's the only wet food they get all day. It can be hard for these cats to find water more than it can be dry food. What else? While I was out there, what all happened? I watched a lady with her dog. She walked it off of a leash for one. It's an elderly dog though, so I can understand why it might be off a leash. She had the leash in her hand though, in case she needed to put it on. But I noticed that she was like way down the sidewalk and the dog was in my front yard, kind of lackadaisically walking around. But I also remember that this is the same dog that I saw in the alley mornings, like months ago, some morning, eating dog shit, like just eating it like it wasn't nothing. So I'm thinking like this dog's either gonna shit or maybe tried it, maybe like it could be eating it. She's like, I don't know. I feel like it's not very responsible to not watch your dog when it's walking around someone else's yard like that. It is a known shit spot for the dogs. Like, do you want your dog eating shit? But beside the point, she comes back and we have her like good mornings or whatever, and because her dog was like walking my direction, it looked like it was taking a shit. I think it just peed, but it peed on my neighbor's overgrown grass, so that's cool, I guess. I did pick up a little dry turd from their side, just to get rid of it, and what we got? Something else happened when I walked down the alley. What the hell was it? Oh, all the trash, all of the dumpsters were wide open. Both of the doors, both of the bin doors wide open on every single one of them. 3 big ass dumpsters. Tens of thousands of flies, dude. I'm talking about, it was like an unimaginable amount of flies on top of these, inside of them. So I need to look up right now on the AI, like if, like I shut them all, if they should be open or shut, if the flies can still get in through cracks. If in my alley there are 3 dumpsters with lids that have gaps that allow the flies to get in when closed, and are in direct sunlight for a large part of the day. With that information, that flies would get in anyway, but with shade inside, should the lids be closed to limit smell and shade and allow them to stay longer without dehydrating. I was thinking about all that as I was out there, and I need the AI to answer that specifically for me. Closing the lids and answers is the better choice. That's what I did. Thank you. These motherfuckers, dude, they keep leaving the lids. Here's what they do. They rummage through the dumpster and they leave the lids open. Dude, when I closed them, so many fucking flies flew out, dude. Like, now where are they gonna go? You know, there's that too. Closing the zoom nose is a better choice despite the gaps slowing fly entry. It primarily reduces odors and attracts more flies from afar, outweighing any minor shade benefit inside. Close the lid traps smells from decomposing waste, making the dumpsters less noticeable to flies scouting for food sources. Direct sunlight already heats the dumpster significantly, speeding decay and odor release if open, so lids help contain this. Experts universally recommend tight lids as the first defense against fly attraction and traffic. Yet they're not tight, that's why I let it know that. Flies prefer shade over direct sun as sunlight, that's what I was saying. Sunlight dehydrates them faster and they seek cooler spots to rest. Inside a closed lid, and any trapped flies might last slightly longer in shadier, more humid environment compared to open dumpsters' sun-baked interior. However, dumpsters in sunlight stay hot regardless. Metal, dark lids absorb heat, and flies breed rapidly on moist waste anyway. Shade doesn't prevent infestation. No, but does it make it worse is what I was saying. That's what I was saying. That's why I was like, I need to know for sure if they should be closed. With gaps, flies enter either way, but open lids invite more via easy access and broadcast odors widely. Closing prioritizes limiting attracting over worrying about trap flies dehydrating quickly. Now, I'm not worrying about them dehydrating. You motherfucker, I'm not worrying about them dehydrating. Are you fucking weird? I'm concerned that the closed lid would allow for a better breeding environment. Closed lids do not create a better breeding environment for flies compared to open ones. The primary factors for fly breeding, moist, organic waste, and warmth, are generally present inside dumpsters regardless of lid position. Flies breed in damp, decomposing matter like food scraps where humidity and heat speed egg hatching as little as 7 days in summer. Closing the lid mainly contains odor that draws in new flies, reducing overall numbers entering via gaps. Without odor escape, fewer females lay eggs, even if some get inside. Open lid allows easy access and spread smells widely, worsening infestation by attracting more breeders from afar. Closed lids might retain some humidity, but sunlight heated dumpsters stay hot and suitable for larvae anyway. Lids are still recommended by pest experts. No sources indicate closed lids promote worse breeding. They help control it. Keep lids closed. Empty dumpsters frequently, twice weekly in heat, and clean drain waste to minimize moisture. For your sunny Long Beach alley, external shading or enzyme cleaners could further disrupt breeding without... Oh, yo, I can start dumping some shit in these dumpsters, dude. Enzyme cleaners. I'm going to be looking into this shit now. I'm going to be looking into what I can... I'm going to get a bulk amount of this fucking... Dude, this summer I'm helping this alley. Okay. What could I put in the dumpsters to kill or disrupt the flies from wanting to be there, or keeps them from breeding? There's probably multiple shits for all these. Natural accounts like cinnamon essential oils, diatomaceous earth. I have a bunch of that. I have a bunch of diatomaceous earth, dude. I can just, oh man, next time I see those dumpsters all open down the alley, I know it's my time to shine. Go down there with my diatomaceous earth, dump it in there and close them. Dehydrates larvae in adults on contact. Any pills for limonene repellent? Dude, I have a whole bottle of limonene right here. I have like actual limonene, dude. 100% organic, baby. It says non-toxic, but apparently it is for them suckers. So lemony. But I try to take a lot of this, wouldn't it? I wonder if I can spray this somewhere else though. Yeah, man. So, and the verdict is in. The thing should definitely be shut, not left open like that. Even if the flies can get in through big ass gaps, it's still. Yeah, dude, what are they doing? Those fucking people really pissed me off, actually. Here's what happened. There's this one guy, there might be two of them. They rummage through the dumpsters, and when they're done rummaging through the dumpsters, tearing open all the bags, and all the food waste all over the fucking place, accessible to the flies, just so that they can get a fucking plastic bottle out of there or some shit, dude. Now they've done created like a fucking 100 or 1,000 flies just so they can get a plastic bottle out of somebody's trash bag. You know what I'm saying, dude? It's that kind of shit, bro. Get a fucking job, man. We don't need you doing that shit. You little fucking asshole. Fuck you. They're homeless people that do this stupid shit are helping to spread disease. Actually. But we use it in our society. We use these things for a reason in America. That's because there was a time when we didn't use these in America. And fucking, we had a severe fly problem. It was worse. You know, when we didn't have trash pickup in cities, it happened. One of the main reasons we have trash pickup weekly is because of larva gestation period. Flies. It takes a week for them to turn into flies. They want to get them out of here and get them out of the city. The larvae out, the maggots out. Which is why I double bag my stuff just in case I have to go 2 weeks. And flesh flies do it even faster. And we have flesh flies here too. They're the bigger flies. See, they don't lay eggs. They actually just produce larvae that are alive and crawling. I got one on live stream one day that birthed a bunch of them over here on my counter. It died. It was dying on its back. And next thing I know, a bunch of stuff starts coming out its butt, dude. And I noticed it was moving. I looked more into it and realized it was a flesh fly. And what's more interesting is at the time, I had an old rotisserie chicken out on the counter, and I was deboning it. I was getting the last of the meat off the bone for it, so it had been sitting. I think I had a lid on it though, but like this fly decided that moment with this meat, because the flesh fly, they look for like rotted meat. It wasn't rotted, but it smelled of meat, I guess. It was like, this is my time. I think it was actually trapped in here or something though, and I got it out of here, and then it ended up having them right here. Sister T was here for that. So, got all that done. All that done, boy. I ended up getting Daredevil 2 last night at the last absolute second that I could have gotten it. It was a pretty interesting night with the last. Did anybody catch that last game last night? The very last game I played? I was going all for nothing, man. I spent so much on light impact grenades. Hundreds of thousands, I think. But I had a mission at hand. I needed to make 1,000 more points or something. And I don't even think it was that many. But I got it by like 200. No, I needed to make 200. Wait, yeah. I can't remember how many. 500? I'll have to look back on it. But I look at it last night and I just see what the heck I had to do and ship it. Dude, it was close. Otherwise, I would have been in Daredevil 1. I skipped 2 places because I got 15th place. 15th place for trials, baby. 15th place for trials, all solo trials, except for like one map where it was open containers and not hotel. I could have done it though with there was a bunch of cool raiders that picked me up, dude, honestly. And there was another one that was gonna down. He was like shooting me inside the extract, and then he was cool and letting me like we left together. But yeah, man, it was intense though, dude, because I was going up against a bastion, and I had that little spot in the tunnel, and I was just throwing impact after impact after impact, hoping it would finally hit the. And I already the thing is, I already had 3 stars in it, but it's I couldn't get the event for the turbine to trigger enough, or I couldn't get it to trigger to where I could get enough damage on it to get enough in that event to make the points. So I was like, that's why I just went after. I was like, dude, the only way I'm gonna make these points up, I'm gonna have to just hit the light grenade one really hard. It's gonna cost me a lot of money. I'm just gonna have to hit it. And I got so close on the next to the last one, but I died. I got it, and I fucking died, dude. And I yelled. It was like 11 at night, and I fucking yelled, dude. I was like, wah, ah, ah, because I saw it go beep, new personal record. I was like, oh shit, that's it. I don't even know if I would have really had it though, with that much, but I could have gotten a little bit more after that. But like the instant it said boop, new high, he turned and got me, dude, and I was like, oh my god, dude, I gotta buy all these light grenades again. What the fuck? Nobody picked me up, so like I had to do a whole another loadout. And here's the kicker: I only had 21 minutes at that point, or 22 minutes before trials was over, and I didn't know if I would still get the trials if they ended while I was in the game. So I didn't know if what I was doing was going to be for nothing, but I was getting delirious. I was buzzed. We gotta do this. I don't want to be 1. I want to be 2. I want to be 2. Loaded up with all kinds of fucking lights. Got the showstopper. No, did I even have the showstopper in that last one? I might not have. I wanted one. It worked out though, man. Oh no, I put a bunch of fucking seekers so I could take care of all the flying shit first, because it was fucking me up. it wasn't allowing me to get as much damage as I wanted on the Bastion because they were keeping me busy too long in the beginning. So I figured that out. So that way it would hopefully be only me that took the Bastion out because I would be the first one there in my little spot. My spot's dope too. But it worked. It fucking worked that last time. It worked. I got out. I even stayed up, dude. I was so stoked on it. Like I turned the stream off and it said it was going to update the ranks in an hour because it needed to let all the games finalize, I'm assuming. Kind of like how mine went past the time. They had to let everything finalize and verify everything that was good. And then once an hour later, I refreshed and it goes, Daredevil 2. I was like, yeah. Because the Daredevil 2 emblem's got the little flare going up. It's where the flare gets involved. Before that doesn't have the flare in it. Daredevil 1 doesn't have the flare on the symbol. So it looks pretty fire. I'm stoked on it, dude, because I busted my ass for that shit last night. I don't even think anybody was in chat, dude. I was just going for the gold. I got 15th, dude. That's pretty good. 15th out of, I don't know how many players that was, like 70 or something, 80. I can't remember how many are in each bracket. But, yeah, I beat out, dude, like the very last game, I beat out somebody that's now going to be 1 promotion. He was going to be 2, now he's 1. Simon. Too bad, so sad, buddy. Oh, and before I went live yesterday for the afternoon stream, I actually won another headset. But this one was a bid. And I remember, I think I was talking about it. I bidded, though, at the very last 10 seconds. And I was the only bid. And I ended up getting it for, it's headset only. And it looks like it's in really clean condition, too. Plus $10 shipping, but $35 total with shipping. $35 total for just a headset, and that'll be like my backup in case anything goes wrong. That's like a really good deal for if it's in good shape. And then the one that's brand new with the 3-year warranty, I got an extra 3-year warranty put on it for like $25. That totaled out for like $200 with shipping. So we're gonna have a new headset. Gonna be able to hear what people are saying. They're gonna be able to hear what I'm saying without all the fucking static eventually, y'all. It's happening. It's gonna happen. We're gonna be able to have more interactions and I think they're more entertaining streams when I'm able to play with other players and they can actually hear me. Right? I think they're way more entertaining than for me, definitely for me. When I can't talk to people, I'm kind of bummed out. Like, hey man, you're breaking up, I can't understand what you're saying. That really bums me out. So, and I can even take the used one that I get and resell it with the with all the other items from this new box. I just sell it as an open box if it looks good enough. I probably still make. I could probably make my money back that I'm spending on this new one. Probably if I do that, because I got a pretty good deal on the new one at $200. Pretty good. When's it gonna be, dude? I'm stoked to have a new headset again, dude. I've been wanting one for a while. I got it for $206. It's the other one was crazy low for the auction, man. I kind of felt bad for the guy. Oh, one of them's already with the carrier. Which one? Oh, the brand new one's already with the carrier. Oh man, it says it won't be here till Friday. Wah, wah, wah. Maybe the other one will get here faster. Oh no, he's only on pre-shipment. It's coming from further, so probably not. Are they both shipping at the same? So one of them's being shipped via. Let's see here. Doesn't say. Ground Advantage. One of them's Ground Advantage. Is that bad? Yeah, that's ground, so that would be slow. What's the other one? What is the other one? What is the other one, man? Oh, motherfucking, both of them are using Ground Advantage. What does that mean? Use Ground Advantage is budget friendly, 2 to 5 business day service for packages up to settings set out for non-urgent, light or heavy items. Priority mail is faster and often better for time sensitive, high value shipments. Okay. Oh, significantly cheaper. 4 pounds retail packaging, significantly cheaper than priority mail. Saving you between $6 to $10 depending on distance for the two. See, oh, I see. Right. So this says Ground Advantage is 13 to 16 approximately, but priority mail would be 20 to 25 plus. It's like almost double the price, so that's why they're going the slow ride. Take it easy.
So in taking on the persona of zero,
She just said taking right after I said take it easy. Did you hear that? Connected, baby.
it sounds to me that that was just his way of being able to tell the police the truth.
That's that would be my testimony, yes.
And so how do you tell that's just not another manipulation?
Again, I don't see in the interrogation what he would get out of the manipulation. I don't see any gain. They know that he did it. He said that he did this. I don't see that there's anything else that he would gain. You know, you've got to understand that Tanner also takes on other personas. I mean, he sees himself as a moral character. He lives in these movies. He takes on other
What do you
identities.
mean he doesn't see
Not
any
in terms
gain?
of going to work and acting like he's
He
super.
doesn't see any gain. He knows that he's going to be up for the death penalty, lady. Maybe he doesn't see any gain. He knows why you're there talking to him, doesn't he? He knows why you're. Hasn't he even explained to why you're there? Doesn't know any gain from it, huh? I don't believe that. That's stupid.
Man. But in terms internally, fantasizing is some of these characters that he could be that competent, that he could fly, he could be the superhero. And he lives in those movies. He lives in that music. He lives in another space because, as he puts it, the Tanner space is not the best space to be in.
He puts it, as he puts it,
Could that be perceived
as he puts it, the Tanner space is not the best place to be in. That's like he's sitting on the pity pot, man. He's fucking, you know what I mean? Motherfucker's feeling sorry for himself a whole lot. Poor me. Motherfucker just killed a kid, he's still feeling sorry for himself? That's crazy.
as a ploy to feign insanity?
And
I don't-
he
what-
didn't just kill her, you know what I mean? Dude, come on, and you're so good. Bro,
This way, he's never feigned insanity with me, ever. He's never said that he's got psychotic features, or he sees things, or hears things. There's nothing like that. He speaks about his depression very rationally. I don't see that. I did not see any feigning during the interview. I did not see him telling the officers, I have a severe mental illness, I'm mentally ill, I think that you're the devil. There's nothing like that. He is just somebody who comes across as very incompetent and unable to relate on an adult level.
Dr. Brahms, I want to shift gears a little bit, and I want to talk about antisocial personality disorder,
Okay?
also known as ASPD.
Yes.
What is ASPD?
Well, obviously it's antisocial personality disorder, okay? And I don't want anyone to get mixed up with AS, which is autism. Okay, antisocial personality disorder is a long-term ingrained way, maladaptive way of perceiving and interacting with the world, like all other personality disorders. Antisocial personality disorder means that the core of your character, the way you perceive the world, the way you interact with the world, is antisocial in nature. That your primary responses to situations would be to act in ways that are criminal or in some ways against the values of our society. So it has to be long-term, chronic, and it has to be really the core of who you are.
When you evaluated Tanner, did you find that he met the criteria for a diagnosis of ASPD?
No, I did not.
And why not?
Why did I not see that? Okay, number one, you have to look at differential diagnosis. Tanner has done some things that people might think were a little creepy. He's done some things that are not right. He may have been involved in some sexual other activities that may have been illegal. Never was convicted of those, okay? But he does things that are impulsive and not always in his best interest or that of others. However, when he thinks about the world around him, I never saw anything that he thought about thinking as criminal things. I have dealt with criminals for over 40 years, and their attitude is always criminal. They talk about their past experiences with bravado. They talk about being so tough and, I can sell drugs on your street corner. I can do this, I'm the toughest criminal. I don't see anything like that with Tanner. I don't think that the things that he emulates are superheroes, not criminals. The movies he watches are not, criminal movies. They are fantasy movies. I don't see anything in him chronically as with Jackie and his mother and people who knew him, his teachers. Nobody ever felt that there was a criminal attitude about Tanner.
dude, my tiles are really dirty.
The opinion that Tanner does not meet the diagnostic criteria for antisocial personality disorder is based on the evaluation that you did of him,
Yes, ma'am.
based on the interviews of, sounds about at least 6 or 7
Yes.
collateral witnesses,
Yes, ma'am.
and then the records that you reviewed,
Yes.
and the hours that you spent with Tanner.
Correct.
And nothing in any of that would lead you to believe that he meets the diagnostic criteria for antisocial personality disorder.
That's correct.
Can the symptoms of his autism spectrum disorder, how do you determine what is autism and what is antisocial?
Well, you have to understand what it means to be autistic and understand patterns of behavior. You know, when I said Tanner's textbook.
That's a clean one. That's a dirty one.
So you have to look at the fancy etiology. You have to look at the foundation of their behavior. So when you look at Tanner doing certain things, you have to understand that it's from the perspective of someone that has a neurodevelopmental disorder. And you have to understand how he thinks about the world. Did he think about doing something to be
Might need to do
a
something
criminal
with that.
act? Or is just a behavior that he doesn't really understand how other people would perceive this as maybe inappropriate or maladaptive? So when you always have to make a differential diagnosis. So for instance, this is maybe a silly example, but years ago I was giving a lecture to some teachers, and we were talking about diagnosis. And one lady raised her hand and she says, you know, I think my husband's crazy, this is what he does. And so this is what he does. Every Saturday he gets up and he mows the lawn wearing this pair of Aggie shorts, and he smokes a cigar. And he goes around and he's got no shirt on and he mows the lawn. So she goes, is there something wrong with him? So you make a differential diagnosis. Number one is that this might be just his way to relax. Number two, he just might have some oddities to his personality. Number three, you should be really happy he's doing the lawn. I mean, these are the differential diagnosis. Now, I could come on and say that's inappropriate. He's wearing a shirt and no shirt and these stupid Aggie shorts, and he's showing off because he's a narcissist and he's a pervert and this, that, and the other. But then I asked her about him. He's a wonderful father. He's very silly. He makes stupid dad jokes. He is a stupid dad joke person. So she was just raising her hand in a teacher's workshop. But that is a differential diagnosis. You have to understand the person as a whole before you look at the behaviors and decide what the foundation of those behaviors are.
So it sounds to me what you're saying is that you don't take things at face value, you have to dig a little deeper.
Absolutely. And you would expect that if you went to a therapist. You would expect that for your family, much less for a court. It's very important to dig deeper and just not look at a symptom or a behavior as behavior. You have to understand where that came from.
Can someone have an antisocial trait and not be diagnosed with antisocial personality disorder?
Well, all of us have antisocial traits. All of us have done some antisocial things. There's not a person among us who has not anything could be considered antisocial. You know, what does that really mean? Have you ever filled your cup up at McDonald's twice and really supposed to get one refill? Many people have. Okay. We've all done things. Have you ever run a stop sign? I have. Okay. Have you ever done things that are probably wrong? Yes. Everybody has done things that you know are against the law. Okay. And little things or bigger things. The question is, we all can have some traits and some behaviors, but that doesn't mean that we are diagnostically antisocial. It may mean that we're more risk takers than others. I mean, somebody on the jury might never fill up their Diet Coke again. I have. I mean, okay, I have because I had to be in court and I'm in a rush. I just put some more Coke in there. Is that stealing? I guess. Although one of my clients worked for McDonald's with all their profits from pop, so I felt less bad. But the reality is that an antisocial attitude, Ms. Anderson? Probably a little bit. But does it give you a personality disorder? No.
Well, can someone commit a crime and plead guilty to? Can someone do something that horrific and still not be antisocial?
Yes.
The last thing that I want to talk to you about is his impairment. Dr. Braun, did Tannen's impairment cause him to commit the act to which he pled guilty?
No, but they set the stage for his life.
Are his impairments and his deficits any sort of excuse for what happened?
No, and I need to say that none of my testimony in any way should be implied as an excuse for what happened. This is only an explanation of who this defendant is so that whoever decides his fate understands him as completely as possible, because it's absolutely not an excuse.
What about his justification? Do his impairments justify the kidnapping, assaulting, and murder of a 7-year-old child?
This has nothing to do with justification. It has to do with understanding the person who's before the court and being able to weigh their strengths, their weaknesses, and their abilities, their ability to be compared on a level that maybe you or I would be.
And lastly, Dr. Bonds, you spent time with Tanner in the jail,
That's correct, ma'am.
saw him interacting with guards,
Yes.
saw him interacting with other people in the jail.
A couple, but mainly correctional officials.
Based upon your review of the records and your observations of Tanner, how well has he adjusted to life in prison?
I would say he's adjusted very well.
Have a moment, Your Honor?
Yes, ma'am.
I'll pass the witness, Your Honor.
Cross-examination? Yes, ma'am. Ma'am, how many psychologists does Tanner Horner have in this case?
I cannot hear you. I'm sorry, you're drinking water. I couldn't understand you.
How many psychologists does Tanner Horner have in this case?
As experts,
Yes.
I've never counted. I can try.
Well, he has Dr. Ryan, who you talked to, right? Is she a psychiatrist, psychologist? What is she?
She's a psychiatrist.
Okay. And you got Dr. Spence and Dr. Emhoff.
Yes, one's I think is more of an autism. They're both autism specialists.
Right. And then you have some other people. You have Dr. Davies, who you talked about, had the fetal alcohol thing, right?
Right. I know Dr. Davies. Yes.
And so would you agree with me, there's been a whole lot of people interview him consistently over the last several years.
That's correct, sir.
Interviewed him and asked him the same basic questions you're asking him about his family history, how he grew up, traumas, all of those things have all been asked multiple times.
In different ways, yes, and for different purposes, but yes.
And so in this particular case, let me ask you, did you review all of their reports in this particular case?
Yes, I did.
Okay. And let me ask you, where's your report?
I do not have a report
Well, why not?
because my testimony was going to be based upon all of the other people's reports, and that is what was agreed to by the defense, that I would wait until all reports were submitted and testify from the information I have, not just from the reports, but from obviously many other sources.
Okay. So I guess what I'm trying to figure out, you didn't do any testing.
No, he's been tested and tested. There was no need for me to do testing.
Okay. So part of what you're doing today is just simply repeating what other people have already said in this case.
Absolutely not.
Well, you're repeating things that you got from Dr. Ryan.
I didn't know that I was repeating directly from her report at all. I'm talking about Tanner's development. She's talking more about diagnostic issues, but I don't believe that I quoted her report in my testimony.
You don't have a report that we can look at with regard to your findings and tell us that before we came in here today and you testified.
That seems to be correct, yes.
I'm just going to start from where you ended here. You said that Tanner has adjusted to jail life, correct?
That's correct, sir.
And that's because he's been in SEG the entire time, correct?
Well, it could be, SEG is difficult to adjust to. Sometimes people have a lot more problems in segregation than they do in general population. So that's a difficult question to answer.
Good point.
Well, being in SEG, he's had no
No
changes because he's been in SEG.
Not any meaningful changes, not a lot. Some,
He's had structure because he's been in SEG, correct?
that's correct.
He's had a routine because he's been in SEG, correct?
Yes,
And he hasn't had at least access to any other inmates, correct?
not really,
Physical
no.
access.
No,
Okay. And the only people he would have access to would be guards that come by and interact with him at some point.
That's correct, sir.
Now, I'm trying to figure this out here a little bit here. You talked about he's got some development problems as a child. Is that right?
He has many problems with his development over the course of his trajectory of life. Yes, that's true.
First thing you said is that he had a problem with reciprocity and attaching to others.
No, that's not what I said. What I said was the environment that he lived in and his mother's difficulty would make it difficult for him to have that stability and reciprocity. And I think that you see that in his adult development. That's what I testified to.
All right, and so because of that, that's why we've ended up here today. Is that what you're saying?
Absolutely not. I think I just testified with Ms. Anderson that I'm not saying there's a correlation between what he experienced as a child and this terrible crime. My only role here today is to try to give information, unbiased information to the jury so they can understand Tanner more fully. I've not talking anything about the causality of this terrible crime.
All right, so all the stuff that you talked about with regard to his development up and through his childhood, you're saying that didn't have anything to do with his crime?
It has to do with the jury understanding what his functioning was like at the time of the offense and what his impairment has done to him over the course of time.
All right, so let's talk about that. Did you watch the audio and the video in this case?
Of what? Of the interrogation or?
Of the murder.
Yes.
Okay. And you've testified, and I'm going to try to use some of the words here, that he can't handle stress, he's impulsive. Trying to remember several places here, but essentially he doesn't have the ability to cope. Am I right so far?
Generally, yes.
Okay. And
Well, to cope adequately.
cope adequately.
Yes.
So what is your belief as to what happened that precipitated him kidnapping Athena Strand? What's your belief on that?
I do not have a hypothesis. I've thought about this a lot, but that's not my job to address that.
Okay, what did Tanner tell you went on before he kidnapped Athena?
What he told me is that he believed that she saw him starting coke, and he felt that this would be detrimental to his job. That is what he shared with me.
So do you agree with Dr. Ryan that this was all some form of catastrophe and cascade of decisions because of his disability that resulted in this? Do you believe that?
Let me slow you down for a moment. Dr. Ryan did talk about catastrophizing, which is a term that's used often in autism. Do I believe he catastrophizes or digs himself deeper in a hole? Absolutely, 100%. He's done that in relationships and jobs, as a middle school student.
That's way cleaner.
So I don't know about Dr.
You getting
Ryan.
there?
I believe that her observations and her findings are correct. At least they're in agreement with what I feel independently about him.
And so you'll agree with me that everything with regard to that
Way
theory
cleaner.
begins with what Tanner says he saw at the time before he did it. Everything begins with that.
Compared to this.
My job is not to talk about the offense. You asked me, does he catastrophize? I agree with Dr. Ryan. I might use a different word, but I totally agree that he gets himself in situations where he can himself out.
I mean, don't you think the facts of the offense in this case are the most important thing that we can talk about?
But that's not, it's important for you to talk about it because you're the prosecutor.
No.
My job in this is only to talk about his case, only to talk about, to integrate what we know about Tanner, what we know about his disabilities, or I would like to say impairments, more, it's not really disabilities, it's a pervasive impairment. It's not to talk about the offense. That is for other experts to talk about.
But you agree with me, you're offering it as some form of explanation as to why he did what he did.
I'm not sure you listened clearly to Ms. Anderson's question, and I apologize if I was not clear enough. I am not offering this as an excuse or explanation for anything. I'm offering this because in a court of law, it is the jury or judge's responsibility to understand who they are sentencing and what that person's capability is. I am not talking about defense. I'm not hypothesizing about anything. What my role in here is to present to the best of my ability what this man's development is like and how he ends up being the person that he is. And that is what I was retained to do, and I hope that I make clear as I possibly can.
Let's talk about his capabilities, since you mentioned that. In the murder video, you're aware that he had a pattern of covering up the camera immediately before, on two different
I'm not
days,
done yet. I did
before
something.
you arrived on the same exact
We're gonna
road
do
where
more.
he kidnapped Athena. You're aware of
I
this?
need to eat something.
Not in detail, but I've heard those facts, yes.
Okay. And if those
Or
facts are
certainly
true, you
better.
agree with me that that's some form of pre-planning or planning before he goes and does this to Athena?
I don't know that. I never discussed that with him.
And then at the point at which you said that he has, I think you said
Good
he
job,
has
though,
problems
Miss
with impulsivity and problem solving, and I think you mentioned the word meltdown. Is that right?
He's had a long history of meltdowns in various ways, ever since he's been, 2 or 3 years old.
And when you watch that video of the
We
murder,
all.
there's no evidence of it having a meltdown at that time.
Two.
Well, I do not know what was going on with him.
Well, 2 years
in terms of
meltdown,
his
okay.
thinking, because his meltdowns as he became older are more like the stress reactions that I testified to about before. The confusion, the not knowing how to get out of a situation, the anxiety. He has continual anxiety. So I don't know. I do not see behaviorally a meltdown, but I cannot say that he was not, in terms of his emotions and anxiety, not having difficulties in figuring out how to handle a situation. I don't know that.
Well, where did you see on that video of the kidnapping murder that he was confused?
Again, let me say that I did not see that he was confused. I do not know what was going on with him, but I do know that his massive reaction to stress, that his inability to get himself out of situations, that his ability to plan and to think about the best way out of things, this has gone on throughout his entire life. I mean, he ran out of Outback Steakhouse because the beach was occupied. That is how Tanner copes. He just cannot figure out a way to interact with people, problem solve. That's what he does. But I do not know what happened next. Nor is it my role to talk to Tanner about what happened. Whatever he volunteered, I took into consideration. But that's not my role in this hearing.
You used the example at Outback and you said the dishes were too high. You know that's not the complete truth, right?
No, it's part of the truth, yes.
Okay. So what's the whole truth?
He did not show up at work at some point, I know that. I don't have all the details about Outback, but what he did share with me was avoidance, was leaving, was quitting, was sitting there and looking at dishes and having a panic attack, which is absolutely prototypical textbook for someone with autism. It's nothing really unexpected. I've had dozens of young people tell me that they've left their place of work because they're overwhelming anxiety and confusion. So what he's telling me was not something to write home about. It's very much diagnostic.
Just wasn't the truth.
I don't know what the truth was. I know that he was honest and told me he didn't show up for work. He told me he was more overwhelmed.
You said he has problems with problem solving and low process speed. Did I read that correctly?
Slow processing speed, yes.
When he's committing this offense, is he having problem solving issues and low processing speed?
My guess would be that, if you look at this, and again, I'm not talking about defense, is that I think making decisions is difficult for him, and it would not surprise me if he did not have a well thought out plan about this, but I do not know that. I know he does not have a well thought out plan about many things, and I know his ability to process information effectively, both by testing, is very clear in the testing, and also by other people's evaluations, is limited. That's all I can answer.
You talked about Zero like being an imaginary friend. And you said that when it came to the interrogation, that was his way of talking to law enforcement. Was I right about that?
It was his way of trying to share what happened without, if the word wouldn't have taken responsibility, but it would be very difficult for him to talk about those things. And this is how he's going to cope. This is something over the course of time. This is not new to this evaluation. I mean, excuse me, to that interrogation.
But in that interrogation, whatever imaginary friend he created didn't actually tell the truth, did he?
No, I'm very well aware of that. Is that what he does is I use an imaginary friend example before he was. But what we're really talking about here is a not integrated person who copes in a way to try to distance himself. Instead of being an integrated part of him, he distances himself from the zero. You know, it's very easy to focus on zero, but we have to focus on the totality of him.
Well, you understand that when he was playing his imaginary friend, like you said, he was making up a consistent pattern of lies during the entire time, wasn't he?
There were a lot of untruths, that's true.
And he was also able inconsistently to make up a pattern of information, where things were, details, directions, and things like that, correct?
Well, many of them were not correct, but yes, he finally gave details that led to finding Athena.
But still stuck with his lie about backing into her and everything else.
Whatever that was, yes, he told a story that clearly was not true.
And you know, he still lied about that in January of 26 when he got interviewed by Dr. Fritz.
I remember
He came
that.
back to that too.
Yes, I don't remember the month, but yeah, it was earlier this year.
So is his imaginary friend back when he's talking to Dr. Fritz?
His coping mechanisms are the same. His coping mechanisms of whatever his inability to tell the entire story is there. I didn't know that Dr. Fritz was going to ask him about the offense. I certainly was not.
So he copes by lying.
At times he surely does.
And he copes by avoiding responsibility by deflecting it off on anybody but Tam.
Many times, yes.
I stepped in the soap.
I think you mentioned before, talking about theory of mind, and I believe you said, and correct me if I'm wrong here,
Certainly.
It's a problem with person having an understanding of other people's mental states, desires, intentions, emotions, things of that nature. Is that right?
I wish I was that articulate. You do that very well.
Well, I'm repeating what you said, so.
I said that?
Yep.
Oh, that was good. I'm proud of myself. Yeah, it's a difficulty in perceiving how other people perceive you, and a difficulty understanding like your own emotions. So it's this whole thing about how you perceive others and how they perceive you.
Right. And so what I look at that is, that's also how you understand other people perceive you, right?
Are you talking about me personally?
No. In this particular, when you're talking about here, it's also when a person like you're talking about with theory of mind, it's also their understanding of how other people perceive them.
Yes, there's a lack of understanding about how my actions would be perceived by you.
Right.
Right.
And so I guess in that role, when I watched the first part of the kidnapping video, you'll agree with me that Tanner Horner knew that Athena would be upset, and that's why he covered her mouth to keep her from screaming.
I know that he covered her mouth to keep her screaming, and I'm sure that he knew that she would be upset.
Right? And he knew that that he was taking her to that first location where he stopped, and calmed her down and talked to her the entire time.
I do not know what was going through his mind. I cannot answer that because I don't know about the first location. I do not know the actual specifics that you might be addressing.
You didn't ask Tanner that.
No, I did not. That was not my role.
Now, we talked about, I think you said that Tanner has difficulties in functioning in the outside world.
Well, yes, he does. He has marked inadequacies.
So things like having a relationship, job, friends, social life, being a parent, those were all problems for him.
All of them, yes.
But you'll agree with me that he had a job operating a FedEx truck for almost a year. So, right? Isn't that
Well,
right?
if you count, I guess, the two different contracts.
Yeah.
Yeah.
And so in doing that
Give
job,
it up,
he would
give
have
it
to,
up, boys.
Operate the
Dirt up.
simple task of operating a vehicle, right? But he would also have to operate in a rural environment, correct?
Many of his routes were rural, yes.
He would also have to operate a GPS and operate package delivery, things of that nature, correct?
Probably so.
And you saw in the video where he's operating the FedEx device to be able to scan and deliver packages, correct?
Right.
And so, and he's doing all of that, and you don't see him having any problems doing all of that, do you?
Dirty.
Well, this is what I do.
Dirty.
He does all of those things.
Dirty.
He changed the routes.
Clean.
He had really an internal breakdown, he had tremendous anxiety. He could not get to work on time. Problems. So I don't know. I'm not saying Tanner has an average IQ. He is able to use the FedEx scanner. There's no doubt about it. My mail guy is able to do whatever he does with the mail, but he can't drive a truck because he has some kind of disability or impairment of some kind. So yes, of course, no one has ever said that this is an intellectual disability. Let me be very clear to the jury. Tanner is not intellectually disabled, which is what makes this case so complicated for everybody to consider. This is not, in the old days we called it mental retardation. That's not what we're talking about here. We're talking about a complex neurodevelopmental syndrome.
Ma'am, I'm gonna stop you right
Yes.
there. Let me just go back to this here. You said he can't get to work on time.
Sometimes you can't. Sometimes they had your car.
You know he just got a new car at the time this happened, correct?
I think really recently to that. I don't remember the dates.
Right.
Yes.
And is it possible that him not getting to work on time is because he's partying on the weekends and doing cocaine?
That could be possible.
Is it possible that he can't get to work on time because he's playing video games and watching Dragon Ball Z all night?
Objection, Your Honor. Call for speculation.
Overruled.
I don't know. I don't know. I know that he loves video games. I know that he watches TV. I also know, like other people on the spectrum who are incredibly disorganized, getting his life together, the way that they lived, which was horrendous, just dealing with the daily tasks of life were very confusing to him. He was inefficient. That's the best way I could put it. He was inefficient. And that's just a sign of his impairments.
So back to what we're talking about functioning in the outside world. You read Dr. Emhoff and Spence's report, correct?
Yes, sir.
Where they indicated that they felt satisfied that he had friends and things and a social life. You'll agree with that's what they said, right?
I'd have to look at the exact quote of the report, but I remember them saying that yes, he had friends.
Okay. And he had a social life.
I don't remember those exact words, but if you say they're there, I'll take you for your
Well,
word.
let's talk about this. You'll agree with me that he did have a social life, being in bands, going out with his girlfriend, things of that nature.
Well, the bands were a failure, but he had friends. He did have friends.
Okay. And he had a social life. He went out, did things like normal people do, right?
Well, I don't know about normal, but he did go out and do things at times. They also stayed home a lot.
Okay. And
They
then
really do.
also was able to be a parent and have a child with his girlfriend, correct?
With as much outside help as
The
possible.
way that the prosecution just wants the jury to see this guy like he's just a normal dude, man. Bro, he's clearly wasn't fucking normal.
From the mother's mother, who happened to be a nurse, and with as much help as possible from his grandmother. Despite his best desires and best efforts, it was incredibly difficult for them to take adequate care of that child.
But you agree with me, you said before that he had difficulty functioning in the outside world, but don't you agree that with job, friends, social life, parent, he is functioning adequately in the outside world?
Not if you take those apart functionally. No, I don't agree with that.
He's doing everything else that everybody else does in life, isn't he?
No, he's
Very
not.
poorly. What do you
Doesn't have a
mean?
job, doesn't have friends, doesn't have a social life? How is that?
He's not doing that in a way that would be productive, in a way that's effective,
Yeah.
in a way that would be reflective.
Holding a job for a year isn't a
He's
major
not functioning.
accomplishment.
Yes, he has a job, and he has a child that it was incredible, as much as he loved that child, struggles to take care of. He has a job that was struggles, he has friends that are struggles. All of these, you can, again, we're getting back to the superficial, and my role here is to go beyond the superficial.
Like the prosecution's still trying to prosecute the case.
So you talked about a little bit about his development, that he needed interventions and things of that nature.
That's
right?
correct, sir.
And And again, and with regard to interventions, are you saying that if we had had those interventions, we wouldn't be here today? Is that what you're saying?
I think there's a possibility, yes, I do. I think that Tanner would have taken a very different developmental trajectory had he had the services that he desperately needed when he was young.
I don't know.
So-
Maybe.
What he did in this case, the one thing I noticed you didn't mention, did you ask him about what he did to Athena sexually?
He brought it up very generally, and I did not want to go into the offense, so he told me minimal.
Okay. So if he's catastrophizing, as Dr. Ryan said, and you seem to agree with that is his propensity. But he stops off in the middle and gratifies himself sexually in the middle?
I don't know if he gratified himself sexually. I really do not know. He mentioned one thing about it, and I did not go on with that because that was not my role to do.
What did he mention about it?
He said that he could not get an erection.
That would imply that he was trying to.
Yes,
Did you read the DNA results?
I know the DNA result, that his DNA was found on her. I know that.
You know where it was found on?
Okay.
Your Honor's mischaracterization of the evidence in the record.
I don't,
Wait, rephrase your question.
Just, she said she knew it was found on her. I just want to know if she knows where it was found.
Go ahead.
Where it was found? Where was it found on?
I don't have the specifics, no. I can't answer that question, I don't know.
Why don't you know, lady? Do they just stop caring about the case when they're they get their money or what?
That's what you're showing. Redirect.
Yes, Your Honor. Dr. Holmes, the state asked you about the video of the offense and specifically about putting a sticky note up on camera.
Correct.
Once that sticky note is up on that camera, can you see what happens?
Some of it. I can see him.
But after he puts the cover on the camera,
No,
can't see what's going on in there. So the state is asking you to make a lot of assumptions on what is going on at that time.
that's correct.
Are you able to state whether or not Tanner was having a meltdown when you can't physically see him?
No, I hope that was clear. I'm not testifying or hypothesizing or assuming what happened in that truck.
So if anybody were to get up on the stand and say, I don't see evidence of a meltdown, I do see evidence of a meltdown, I do see this, I don't see that, are all of those just based on assumptions,
They're all based on assumptions.
but no evidence?
That's correct.
With regards to this grand criminal scheme and plan that Tanner is supposedly engaging in, would it make more sense for him to cover the camera before he abducted Athena or after?
Well, that's Tanner. It would have made much more sense for him to have the camera covered before any of this happened.
But that didn't happen in this case.
Certainly not.
So if he were actually planning to do something like this, would it make more sense to have covered the camera beforehand?
Oh, without a doubt.
With regards to Zero,
It is
you
interesting.
had stated that Zero was a coping mechanism. How important, or how does Zero tie into Tanner's propensity for avoidance?
It is a prime example of a propensity for avoidance. Tanner's coping mechanism, based upon his developmental issues, based upon the way that he was raised, is avoidance. Whether it's smoking weed or watching movies, as the prosecutor stated, until whatever time in the morning, or playing video games, His life is complicated. Life is very stressful for Tanner. And escape and avoidance is how he's dealt with things throughout his life. That's what he knows, because he never learned any other way. Despite his grandmother's love for him, despite everything, he just doesn't have that.
But Dr. Braun, you were talking about intellectual disability. Is this case about intellectual disability?
This is why this case is complicated. I think Ms. Anderson, an hour ago or more than that, I testified this case is not a simple case of like abuse. It'd be very simple to come in here and say his mother was in a gang, she beat him every day, and she gave him a gun, and then he killed somebody in a bar. That'd be really easy. This is not easy. Okay, he is not intellectually disabled. He is neurodevelopmentally impaired, and there's a very big difference. This case is not about intellectual disability. This case is about neurodevelopmental complexity.
And Dr. Braun, explain to the jury what intellectual disability is, just so we know what we're dealing with.
Okay, well, IQ is on a scale, okay? It's a bell curve. So what you have is you have this curve, and in the middle is an average IQ, which is 100. And that's fine to have an average IQ. It goes down by what we call standard deviation.
It's not fine.
So like an IQ of 85 is
You're
one standard
retarded.
deviation below normal. An IQ of 70 is 2 standard deviations below average IQ. It goes down by what we call standard deviation. So like an IQ of 85 is 1 standard deviation below normal. An IQ of 70 is 2 standard deviations below normal. In terms of going higher, a 115 is 1 standard deviation above normal, and then a 130. And that's how the population is. Most people's IQ.
My highest was 129. That's cool. My lowest was 119. So I'm 1 or 2 standards, or I've been 1 or 2 standard. What the fuck does that mean? That's the first I've ever heard that shit. These are professional IQ tests. I'm not talking about some internet bullshit.
IQs are
That's
between
pretty
about
cool.
95
Yep.
and about 90 and 110. Everybody's
What else we got?
at 95, and that's how the population is. Most people's IQs are between about 95 and about 90 and 110. Everybody's in there. Then if you have an IQ between 90 and 110, you can live a very good life. You're just intellectually normal. Okay, Tanner's IQ is in that range. When we talk about
I'm not intellectually normal, guys.
in the olden days we called it mental retardation.
I'm sorry to inform you that I am not intellectually normal. Right? I'm not like you people, okay? Okay?
You have to have an IQ of below 70. In a court of law, to be deemed intellectually disabled or developmental disabilities, in the olden days we called it mental retardation, you would have to have an IQ of below 70. In a court of law, to be deemed intellectually disabled, which is a legal term, you would have to have an IQ in that 70 range, and, this is very important, like Tanner, have difficulties with adaptive daily functioning. Tanner has marked difficulties with adaptive functioning. If I had not known his IQ, okay, which I do because he was tested, and I just spoke to him and learned what he did in his daily life, I would estimate his IQ to be lower than what was tested. Okay, that's how he functions, lower. But he's not, in quotes, mentally retarded. This is not a case about that. It's a complex issue.
Yeah.
Can someone have an active social life and still be impaired?
Of course, he did.
Can someone go out to the movies, the bar, restaurants, and still be impaired?
Yes,
Can someone have friends and still be impaired?
of course.
Can someone be a parent and still be impaired?
It's hard, but yes, you could still actually have a
What the fuck is she
child,
talking
but
about? 2
it's
levels.
difficult to do the complexities of parenting.
Can you drive a car, deliver a package, hold down a job, and still be impaired?
Well, getting back to the intellectual disability, there are many people who have IQs close to that developmentally delayed, in quotes, mentally retarded range, and they're serving, they're cleaning the floors of McDonald's, and they're absolutely fine because they can do that type of simple, repetitive work. So just because you have an impairment doesn't mean that you can't work. It's how that impairment affects your functioning in real life.
And Dr. Brahms, you had used the phrase, go beyond the superficial.
Yes.
What did you mean by that?
I mentioned what I testified to is that it is, okay, if we take a clinical situation, if you go take your child to a therapist, that therapist better go beyond the superficial or you should not come back. because they need to get to the core of what is going on, not just the behaviors. In terms of forensic responsibilities, it's my responsibility to go. Anybody can say he had a job. You can say, you don't have to have a PhD, Ms. Anderson, to say that he had a job, or that he had a baby, or that he had a girlfriend, or that he had friends. The question is, what were those like? You mentioned going to a bar. He kept saying things at bars that would really aggravate people, and he thought he was funny. He wasn't. But did he go to the bar? Yes.
Yeah.
Was he socially appropriate
Right.
and made tons of friends? No.
Right?
The state asked you about.
She's really good at explaining this right now.
Several times.
Yes, they did, ma'am.
In this particular case,
To the jury.
did we ask you to talk to Tanner about facts of the crime?
No, you did not.
Would it be important for your evaluation, the development side of it, would it be important for that evaluation to know about the facts?
Oh, I had to know I had to know about the offense, obviously, Ms. Anderson. But I did not, in no way would my understanding of his development have anything to do with what happened in that truck. I am here to talk about how he developed, who he is, what his limitations are, and in real life, what it means to have these neurodevelopmental impairments. Not just a diagnosis or a test score, but what it means for him over the course of his life.
And lastly, Dr. Hall, the state mentioned that you didn't write a report in this case.
That's correct.
Is that uncommon?
No.
But the state had the opportunity to speak with you before about your findings in this case.
Well, they didn't ask me that. That's true. The state can call me. They had the chance to interview in a Daubert hearing, so they knew what I was going to testify about. There's a pre-hearing where you talk about what you're going to testify about, and that was, I don't know, a couple months ago, maybe less than that, something like that. And they also have a right to contact me at other times, and you might want to have a defense attorney on the phone or on the Zoom with you, but it's their right to talk to me, and I would talk to them.
Nothing further.
Mr. Staten? Ma'am, Tanner Horner knew exactly what he was doing when he kidnapped Athena, didn't he?
I don't know that. I did not ask him about the offense.
He knew exactly what he was doing when he sexually assaulted her.
If he's sexually assaulting her, he knew it was sexual assault. I will agree with that.
And he knew exactly what he was doing when he choked her and he beat her to death.
I think that is true. I think he knew that it would cause her great harm, if not death.
That's what. Ms. Anderson?
Nothing further, Your Honor.
May this witness be excused.
Yes, sir.
Thank you, ma'am.
Thank you, sir.
Your Honor, ladies and gentlemen, the jury of the defense rests.
Ready?
Let me see the lawyer just a minute.
Defense on the rest. They're gonna go take him now?
But law, and I don't know what exactly they intended to get out of that witness. I mean, clearly, there are times where development.
Maybe we'll never know. Was there another witness though?
Be seated. We are ready to proceed, ladies and gentlemen. This witness has been previously sworn to testify truthfully. Ms. Duke, Mr. Staten?
Yes, Your Honor, thank you. Tim, would you introduce yourself to the jury and state who your company is?
Yes, sir. Good morning, ladies and gentlemen. Again, my name is Timothy Fitzpatrick. I'm employed with the Texas Department of Criminal Justice.
And what is your position title at the Texas Department of Criminal Justice?
I am the Director of Classification.
And I'm going to get to your CV in a minute, but how many different jobs have you done in the TDCJ system?
I have done numerous jobs. I started off as a correctional officer when I was 18 years old. I have held every correctional security rank, so including sergeant, lieutenant, captain, major, assistant warden, and warden at numerous facilities before I was assigned as the director of classification.
And when you say director of classification, what are your duties as the director of classification?
Sure. So just at a high level, those duties include and begin with the admission of all convicted felons in the state of Texas. So we have 254 counties in Texas. When someone is convicted of a crime and sentenced to the Texas prison system to serve their sentence, I have a department that begins with receiving all of that documentation from the courts. We review and certify that documentation, and then we schedule them for admittance into our custody. We are then responsible for all the physical admissions, so when someone arrives at one of our intake facilities, we conduct intake processing.
Juicy shit is this how you gonna have? Hey, no, what's up, man?
Put them through. We are responsible for all time calculations, so making sure that the intent of the court and what someone is sentenced to is calculated correctly based on all of the court documentation. We assign every inmate that is received to one of our 104 prisons in the state of Texas. So they are spread throughout the entire state, and we have to make decisions on where to best assign those individuals once they get to our custody. Once they're at the facility that they're assigned to, we make decisions on housing, job placement, and things of that nature. We also process all releases at the very end. So essentially the way I like to describe it is it's incarceration from A to Z. It starts at the very beginning before they even get to us while they're in the county, and it ends the day they go out the door. So we are involved from start to finish.
Right. And in this particular position, does that also include the Polinsky unit or death row in Livingston, Texas?
Yes, sir, it does.
And how long have you been doing this particular director of classification job?
I've been the director of classification for about 4.5 years.
And in this particular capacity, how many people do you manage in this position?
My division particularly has a little over 2,000 employees for the state.
And when we talk about, I'm going to use the term staff, is staff, is that term defined, is that just prison guards in the TDCJ system, or who is that?
No, sir. We have a wide array of public servants who work within our prison system, so it's not just the correctional officers.
So what other kinds of people would be considered as staff in the TDCJ system?
Sure. So we have staff that work, like I said earlier, in the classification and intake departments. Those folks do not wear uniforms like our correctional officers. We have maintenance personnel. We have employees that work in the commissaries. So there's folks, all kinds of support functions that have to operate at prison system.
And in addition to those people that are employed by the TDCJ system, are there other people who work in the system but are not technically TDCJ employees?
Yes, we have a large base of contract employees, so all of our medical care is conducted by contract personnel. We also have the Wyndham School District that comprise all of our educational services for the prison system as well. So there's a lot of different contract employees that work inside the fence.
Then what about volunteers? Do you have volunteers that participate in the TDCJ system?
Yes, sir. We have about 29,000 or more volunteers that are approved to come into our prisons around the state.
Okay. And as far as the things that they provide, is that things like clergy, teacher, things of that nature? Is that what they provide?
Sure. So a lot of that volunteer base is for religious purposes. So you have different, whether it's a church group or religious organizations that have volunteers that come in. But also you'll see a lot of things like Alcoholics Anonymous, Narcotics Anonymous, anger management courses, things on how to be a better parent, things of that nature. So there's a lot of different organizations that have volunteers that spend their time to come in and try their best to help on that rehabilitation of the population.
Now, what I'm going to do is talk to you a little bit about the classification of people that are in the prison system, as we talked about, and then the difference between people that are in the Valencia unit, death row, okay? So let's start and focus on classification for people that are actually serving an actual sentence, okay? I'm familiar that there's a G scale that we classify those people on, correct?
Yes, sir.
And I'm just gonna focus on two parts of that, just in the nature of brevity here. What's the difference between a G2 inmate and a G3 inmate?
Sure. So just for the jury's understanding, G just stands for general population. And we have a scale, like he mentioned, it goes from G1 to G5. G5 being the worst, G1 being the very best. The vast majority of individuals, when they're received within our custody, they start off as a G2 custody inmate. G2 just means that they're going to be serving less than 50 years in our custody. If they are going to be sentenced to more than 50 years, anything 50 or above, up to and including life without parole, they're going to start as a G3. So they're starting right there in the middle. And then anything above is going to be a behavioral issue, and I believe we get into that a little bit later, or I can cover that now. And then anything below that G1 is going to be reserved for a very select group of non-violent individuals that work outside the fence.
I want to talk about offenses and potentially some myths here. Is it true that if someone commits a sex crime that they're segregated from the rest of the prison population? Is that true?
That is not true.
And with regard to an offense involving violent offenses like murder, aggravated assault, weapons offenses, are they similar? Are they housed separately?
They are not housed separately.
So let me give you an example. If an inmate is serving let's say a 40-year sentence for murder, and then someone serving a 60-year sentence for as a habitual drug offender, what classification would the 40-year sentence get based on the G scale?
That individual would be a G2 if they have a positive, no disciplinary history. They would be a G2.
Walking in the door.
Sure, walking in the door.
And then the person that's a 60-year sentence because they're a habitual drug offender, what are they classified?
They'll be a G3 walking in the door.
And somebody there for serving
that's interesting. I missed this.
murder, they're going to be what?
They would be a G3.
There was a package on my front porch that isn't for me, but it has my address on it with someone else's name. Fuck it, it says it's from a pharmaceutical company. It was second day air also. Handle with care. Weird, huh?
Anything above is going to be a behavioral issue.
Okay. In the prison system, the classification of people that are in the prison system, as we talked about, and then the difference between people that are in the Valencia unit, death row, okay? So let's start and focus on classification for people that are actually serving an actual sentence, okay? I'm familiar that there's a G scale that we classify those people on, correct?
Yes, sir.
And I'm just going to focus on two parts of that, just in the nature of brevity here. What's the difference between a G2 inmate and a G3 inmate?
Sure. So just for the jury's understanding, G just stands for general population. And we have a scale, like he mentioned, it goes from G1 to G5. G5 being the worst, G1 being the very best. The vast majority of individuals, when they're received within our custody, they start off as a G2 custody inmate. G2 just means that they're going to be serving less than 50 years in our custody. If they are going to be sentenced to more than 50 years, anything 50 or above, up to and including life without parole, they're going to start as a G3. So they're starting right there in the middle. And then anything above is going to be a behavioral issue, and I'm going to get into that a little bit later, or I can cover that now. And then anything below that G1 is going to be reserved for a very select group of non-violent individuals that work outside the fence.
I want to talk about offenses and potentially some myths here. Is it true that if someone commits a sex crime that they're segregated from the rest of the prison population? Is that true?
That is not true.
And with regard to an offense involving violent offenses like murder, aggravated assault, weapons offenses, Are they similar? Are they housed separately?
They are not housed separately.
So let me give you an example. If an inmate is serving let's say a 40-year sentence for murder, and then someone serving a 60-year sentence for the habitual drug offender, what classification would the 40-year sentence get based on the G2?
That individual would be a G2 if they have a positive, no disciplinary history. They would be a G2.
Walking in the door.
Sure, walking in the door.
Oh,
And
man,
then
I
the
missed it
person
again.
that's a 60-year sentence because they're a habitual drug offender, they're
Fuck.
that they're segregated from the rest of.
For less than 50 years,
I'm just going to focus on two parts of that. We focus on classification for people that are actually serving an actual sentence. Okay, I'm familiar that there's a G scale that we classify those people on. Correct?
yes, sir.
And I'm just going to focus on two parts of that, just in the nature of brevity here. What's the difference between a G2 inmate and a G3 inmate?
Sure. So just for the jury's understanding, G just stands for general population. And we have a scale, like he mentioned, it goes from G1 to G5. G5 being the worst, G1 being the very best. The vast majority of individuals, when they're received within our custody, they start off as a G2 custody inmate. G2 just means that they're going to be serving less than 50 years in our custody. If they are going to be sentenced to more than 50 years, anything 50 or above, up to and including life without parole, they're going to start as a G3. So they're starting right there in the middle. And then anything above is going to be a behavioral issue, and I believe we get into that a little bit later, or I can cover that now. And then anything below that G1 is going to be reserved for a very select group of non-violent individuals that work outside the fence.
I want to talk about offenses and potentially some myths here. Is it true that if someone commits a sex crime that they're segregated from the rest of the prison population? Is that true?
That is not true.
And with regard to an offense involving violent offenses like murder, aggravated assault, weapons offenses, are they similar? Are they housed separately?
They are not housed separately.
So let me give you an example. If an inmate is serving let's say a 40-year sentence for murder, and then someone serving a 60-year sentence for a habitual drug offender, right? What classification would the 40-year sentence get based on the G scale?
That individual would be a G2 if they have a positive, no disciplinary history. They would be a G2.
Walking in the door.
Sure, walking in the door.
And then the person that's a 60-year sentence because they're a habitual drug offender, what are they classified as?
They'll be a G3 walking in the door.
And somebody there for serving life without parole for capital murder, they're going to be what?
They would be a G3.
Okay.
Damn. Interesting.
The same as our habitual drug offender.
That's correct.
Damn.
Now, let's talk a little bit about G4 and 5 quickly. G4 and 5, you said that had to do something with behavior. What do you mean by that?
Sure. So as I explained, the G2 and G3 is solely based on the sentence and the charge when they're received. G4 and G5 has nothing to do with their charge or their sentence. It has everything to do with their institutional adjustment. So how are they behaving once they're received into our custody?
Interesting.
Are they complying with rules and regulations? Are they listening to the staff? Are they not getting into fights or altercations? All of those higher custodies, the G4 and G5, is based on the behavior of the individual.
Interesting.
once
Very
they're received.
interesting.
All right. Let's talk about, just for information, let's talk about prison housing. In the
I wonder if
TVCJ,
California does it the same way. That's really interesting. This is Texas, so who knows, but no one's automatically a level 4 or level 5 yard. No, I got the Discord set up like we have yard, like level 1, level 2, level 3 yard. That's what it's about. In the fact, like, what's interesting about that is in our Discord, it only goes up to level 3. As if I don't have the disciplinary yards.
system, what are the two basic types of housing that inmates in the system, whether they're G2 or G3, that they have? What are the two basic types?
Sure. Two basic types is going to be a cell block environment, which is your typical cell that's going to have two individuals living in sort of a bunk bed environment on top of each other in a cell. The other environment is going to be a dormitory. So I surely want to share this, that 51% of the beds in the Texas prison system are a dorm environment. 49% are cells. So those dorms can range anywhere from a small dorm, 8-10 man dormitory, all the way up to about 150 men or women in one dormitory together, essentially in cubicles.
Okay. And so, and again, I'm going to stay focused on just our G2 and G3 inmates, just trying to be efficient here.
Sure.
With regard to G2, G3 inmates, do they have access to either housing arrangement?
Yes.
And then let's talk about movement around the prison. What I mean is when G2 and G3 inmates are moving about the prison, are they secured in any way, handcuffed, shackled, things of that nature?
No, sir. They walk to wherever they're going to be going.
Okay. Even if they're serving life or capital murder?
That's correct.
Is this the same when they go outside?
Yes, there are instances where we have job assignments where individuals could work outside of the fence under armed supervision, but they are not restrained with hand restraints or leg restraints.
So let me back up. When a G2 or G3 inmate that's not going outside the fence, I'm assuming they go outside at some point.
Recreation and things like that?
Recreation.
Sure, yes.
And during that time, is our G2, D3 inmates, are they chained or shackled or limited when they go outside?
No, sir.
Let's talk about meals. How does it work for those in either the dorm or the cell block environment? How does it work for them to go to meals?
When it's time for a meal, the living area where they are at are notified for the meal time. They then walk 25 at a time down to the dining hall. Some dining halls hold around 100 individuals, some hold up to 400 individuals in one dining hall together. So they go in groups of 25, but then once they arrive at the dining hall, it could be a much larger group that's eating together.
And so this is the same whether you're serving 2 years for DWI or or life without parole for a capital murder.
That's correct. They would be in there together.
Is that the same for church and medical? Does that work the same for both religious services and medical?
Yes, it does. Same way.
All right. You said something about jobs.
Are they trying to say? Are they trying to say
inside the fence
that he's a
jobs
danger?
available for inmates?
Are they trying to say that he's a danger to the other inmates? They're trying to keep him out of gin pop and then into death row.
Yes, the best way I like to describe this is think of.
That sounded like, I'm gonna guess that sound was the air filter falling over. Let's see if I'm right. I'm pretty good at getting this. I know sounds, man. I was a sonar tech. Oh my god, I didn't even think it would be that fucking bad. Yo, I didn't even know y'all were capable of such atrocity, actually. Shit. What the fuck, man? It didn't sound that loud. Hope y'all are real proud of yourselves. Yeah. How did you do that? Besides being retarded? I hope it still works. Not the first time. I think Snoopy's done that before. Hey, it still works. This thing keeps on ticking. Alright. Cause you already you made my other lights break. You need to eat more soon too, Sawyer. Get your food over here, just whatever. Feed him again. Whenever bring Simon's food out. I'll give Sawyer back. I'll put back him in the cage. Try to get him to eat some more food. I really wish you would eat, dude, when you're supposed to eat. I really do. I gotta train you to eat at certain times, Sawyer. I can't let you just be a free feed eater, man. What? What? Come on. What? Way to go down. Oh my gosh, I forgot your toys, huh?
Have all the fun.
Oh, he's so cute. Sure, I gotta go. I can tell that you're rushing the gate right now. No. Oh, I had to go pick that up. That's why I went in there. I do wonder what happened, dude. Was Sweet Beat up on top of the window?
Prison like a small city. And so inside of a city, you need every type of job, right? Folks that are going to be preparing and serving food, folks that are going to be fixing, doing plumbing work, or other maintenance type jobs. So there is a vast array of jobs for the prison, every single prison. And it is our goal to ensure that everyone is being as productive as possible while they're incarcerated. And so we do assign jobs to the fullest extent based on their medical considerations.
Yeah. And so is that, whether or not they have a job or not, is that limited by the type of offense they committed if they're a G2 or G3 in?
There is very minimal limitations.
Is it limited by the type of offense as far as violent or non-violent?
No, it's not.
Is it limited by the type of offense, whether it's drugs or theft?
It is not limited based on that.
I'm going to talk a little bit about transport. Inmates that are serving time, including our capital murder inmates that are serving life without parole, are they sometimes transferred between locations?
Yes, we, as TDCJ has to make decisions on those placements around those 104 prisons, as I mentioned earlier. We move anywhere from 1,500 to 2,000 inmates a day on buses or vans all around the state of Texas, so they are moved frequently.
And again, kind of the same similar question with regard to jobs. Is that movement, who you're moved with, limited by virtue of your offense?
No, sir, it's only based on the custody. So when an individual, any individual G2 or G3 custody could be on a bus, and that's with up to 40 other inmates traveling together on the road.
We talked a little bit about medical treatment. Who provides all the medical care for the Texas inmates?
So we have two university partners. So the University of Texas Medical Branch provides the vast amount of medical services and mental health services for the entire eastern and southern part of the state of Texas. And then the northwestern part is provided by Texas Tech University.
About housing, jobs, let's talk a little bit about commonly, how does visitation work with people serving a sentence in the Texas prison system?
So we have two different main forms of visitation. We call them contact visitation and non-contact visitation.
And somebody serving in a G2 or G3 status, like we would talk about, are they available to have contact visitation?
Yes, they are.
And what does that look like for those of us who are fortunately not presently in the prisons?
Sure. So many of them are around a room this size. And within the room, you would have multiple small tables. It could be round or square tables. And the family members, whoever that might be that's coming to visit, including children, would come in and sit at those tables around the whole room. And then the inmate would come into the room and they would sit. I mean, it's contact. So they're allowed to hug. They're allowed to hold hands. They're at the table with the person that's coming to visit them in the room with the other visits that are happening simultaneously.
And any limits on which G2 or G3 inmates are allowed to have this type of contact visitation in these rooms that you decided?
There are no limits as long as the visitors are on their visitation list and meet the policy.
Now, what process is in place to kind of warn these civilians that are coming in there as to who's sitting at the table next to them? What process in place to let them know who's sitting around them?
That there is no process for that.
So the children and other people in the room, they're not made aware of who else is visiting them and what they did?
That is going to be protected information, essentially, so security type information, so we would not be able to tell other families the charge or the sentence of the individual sitting potentially right next to them at the other table.
And typically, how many guards are there in the room?
1 to 2 correctional officers in the room.
Let's talk about other services available to people in G2, G3 status. What type of things, for example, like entertainment, TV, internet, what types of things are available to those G2, G3 inmates in the prison system?
Sure. So almost every living area has what we call a day room area. It's just a common area where there's televisions. They can watch television throughout the majority of the day. They do have access to computers through different educational programs and college courses. The internet access is going to be very, very restricted based on the type of program or course that they're going through. So there is not just internet access for the population. And then they also are provided tablets. So they get a tablet that they are able to get their mail on digitally. They are able to read books on those tablets, send messages back and forth to folks that are outside of prison. They have games, music, books, everything else on those tablets as well.
And that's for all G2, G3 inmates, including people serving life without parole.
That's correct.
Now, we talked a little bit about volunteers that are in the prison system. With regard to these volunteers, kind of a similar question to visitation. Is there any type of divider between volunteers and the inmates?
There is no divider.
And so, for example, if we're having a religious service, is there any process to make the volunteers aware of the people that are in the same room?
No, sir. Those volunteers come in and let's say they are going to do a church service on Sunday morning. We do what's called an all call, so we go to each living area and say, anyone that wants to come to this church service at 9 a.m., come on out and go down to whether it's a chapel or a gym area. It's just a little different based on the infrastructure of every facility, but once everyone gets down there, there could be hundreds of individuals in that room at one time for that service. The volunteers are not made aware of every single convicted felon in that room and what their charges are. And they interact and mingle amongst the population.
Talk about commissary. A lot of people may not know what that means, but give us just kind of a general description of what is commissary.
Sure. So the way to think about commissary is just a store within the prison. They have spend limits based on their custody. So G2 and G3 inmates can spend $105 every 2 weeks within the commissary. They can buy all different kinds of food, drink items, shoes, different small appliances. We sell alarm clocks, fans, things of that nature. So there's a lot of different items, hygiene products and things like that that are for sale.
And is that limited between G2, G3 inmates?
It is not limited, no.
Including someone who may be serving life without parole for capital murder?
They would have access to all those items.
Would they have access to that even if they were on death row, though?
So, just to be completely clear here, is there any, other than the term of sentence, is there any meaningful difference between somebody classified as G2 or G3 other than just their time of sentence?
The only real difference is when you look at basic prison life is going to be a slight difference in the job that they can be assigned to. So a G2 can have essentially any job in the prison setting. A G3 can have any job unless it has access to multiple areas of the prison. So a quick example is a G3 inmate could not work in maintenance because they might have to go and fix a shower on one side of the prison and then fix a toilet on the other side of the prison. So that's multiple areas. But that G3 could work in the kitchen because that's one area, or the industry building. So they surely still have jobs. It's just a small variance on the type of job that they can be assigned.
You talked about G4 and G5 inmates, and that is
way better.
Changes due to behavior.
That is correct.
And when somebody has that type of disciplinary issue, would that cause potentially their classification to change?
Yes, that is possible.
And for example, let me just give you an example. If a G3 inmate, let's say, commits a minor assault, one that doesn't require extensive medical care, is that something that they would have potentially a classification change?
Sure. So if someone commits an assault of that nature, a disciplinary infraction would be written. They would go before a disciplinary hearing officer, and if they were found guilty, they would then come before the unit classification committee. So it's a 3-panel committee who would make a decision on whether or not their custody needed to be downgraded. So they could be downgraded to G4 or G5 if it was more egregious, or remain at their current custody if the panel thought that it was not a significant concern.
So there's a possibility that one could assault a guard or inmate or staff, but not even lose their classification.
That is possible if it was not serious in nature.
Let's say they do lose their classification. What's the process for that to be reviewed and change at a later date?
Sure. So if today somebody is downgraded to a higher custody, they have an automatic review date at the 6-month date of their downgrade. So 6 months later, they would come back before that committee again. We would reevaluate how they've behaved through those 6 months and then make a new determination on if they're going to be promoted or remain where they're at.
And so once that's complete and they get their review, is the inmate then allowed back to the same access they had before?
Yes, if they are promoted, they go back to that same access that they had prior to the discipline.
And is it possible that somebody could commit multiple disciplinary infractions, including assault, over a long period of time and simply just move back and forth every 6 months between their classifications?
Yes, sir. It happens often. It's very fluid. So a classification is a very fluid process, and we do see that often where individuals violate rules and regulations, get downgraded, get promoted again, get given another chance, and then continue down that path of negative institutional adjustment. So we do see that often.
I'm going to talk to you just briefly about, I think it's called restrictive housing.
Sure.
These would be people that are, I would assume, G5 inmates, is that right?
No, sir. Restrictive housing is actually above G5. So it's a more secure housing environment that is above the general population.
And is that based upon the offense you commit when you come into prison or something you do while you're in prison?
It could be a culmination of both. So there's only 3 reasons why we place individuals into restrictive housing. This makes up a very small portion of the Texas prison population, about 1.8%. They have to be a confirmed member of one of our security threat groups or gangs. These are one of our this is not a street gang. These are organized prison gangs. They have to be a member of one of those 5 gangs. Number 2 is they have to be a current escape risk, or they have to be a current significant threat to prison operations. So this is someone who has consistently displayed aggressive behavior towards staff or other inmates. So they have to fall into one of those three categories.
So, it doesn't necessarily have anything to do with what offense they committed on the outside?
Not necessarily, unless, for instance, they escaped from a county jail per se. So that could be a situation where it was prior to incarceration, but the majority of these are situations that have happened during our custody.
While serving time, how does someone tell the difference between a G2 inmate and a G3?
Well, our line staff will not know that per se. They don't wear a different color uniform. They don't have any other identifiers other than for one of our correctional staff members working on the floor to understand or know that right away. There are, of course, reports and things that the classification and administrative staff can see to know who is doing what sentence.
I guess I'm trying to figure out, how does someone in the prison system, whether it's a prison security official, medical staff, or a volunteer, how do they tell if the person they're interacting with has committed a violent murder or they're serving 2 years for DWI?
They would not know that unless they looked him up on the computer.
Let's talk a little bit about behavior management. We talked about how people have reviews in a committee and things. In your experience, what's the best motivator for people to act right in prison?
In my experience, the very best motivator is going to be the possibility of parole.
So the hope of getting out.
That's right. Hope is a critical piece that we try to tap into through management and rehabilitation. But yes, someone's ability, knowing that they have a parole review coming up sometime in the future, is a key driving factor behind positive behavior.
Oh, your guy died. Where is it?
Just in general, prison a stressful environment?
I think that could be a very good way to put it. It is inherently negative, right? You have an environment where you have thousands of people who don't want to be there. And so, yes, it can be stressful. It can be a negative environment, and that's something that we have to manage daily.
Now, I'm just going to talk about a little bit how the prison system interacts with the inmates. Do inmates have any direct control over where they live and who they live with?
No, they do not.
Do they have control over the type of housing that they may have? You said it was dorm or cell block. Do they have any control?
They do not.
And then, with regards to inmates serving a sentence, what is the possibility that their living arrangements may change?
It's very possible. Earlier I spoke about the fluidity of classification, but it goes deeper than that. So each of our prisons have different missions, right? Whether it's a security reason, a medical reason, a treatment reason, there are a large amount of reasons why someone could be moved internally within a prison or to another prison altogether. So that is something at the state classification level that we monitor on a daily basis and then make those decisions.
Where is it?
1,500 plus moves a day around the state.
So, with regard to prison life, is it possible that an inmate's location within the actual unit they're in, is it possible that that may change?
Yes, sir.
Is it possible that who they are housed with in a dorm, is it possible that that changes?
Yes, sir.
I think I already asked you this, but I want to make sure. Is it possible that they may be in Beaumont one day and in Wichita Falls the next?
Yes, sir, that is possible.
And that's just based upon what the prison system decides is in the best interest of population and efficiency.
That's correct.
And given that propensity for change, given that propensity for stress, if any particular inmate who is triggered by that stress and tends to react with violence, does that cause any potential problems while in prison?
Yes, any behavior where the result of their actions is violence, that's going to be a significant concern. It's a concern for my staff, it's a concern for the other prisoners that are incarcerated around that individual. So yes, the manner in which somebody reacts to their environment, especially if that reaction is violent in nature, that is going to be a concern.
And then secondarily, in the prison system, you said there's, I think you used the term infraction, is that right?
Yes, sir.
And can you just give us the 10-cent version of the types of things that may be infractions?
Sure. So you have on the low end things like they're not in the right area, right, or they're not listening to an order that's given to them from a correctional officer, or they're being disrespectful towards staff, things of that nature. All the way up to significant contraband possession, cell phones, drugs, weapons, escape attempts, serious assaults, homicides. It is the full array. Again, kind of going back to just the way it is here in society.
It was a
All
massive.
those infractions that I listed, it's the same thing within prison.
I hated those. Maybe I got it.
Structure and expectations on the way they behave and manage their behavior within prison.
And you said talk about drugs, not to speak ill of the prison system, but there's still drugs in our Texas prison system, correct?
That is a fact of life.
And for example,
Here's the thing, it's more important to kill the bigger flies because they're more likely going to be a flesh fly. Flesh flies are what carry like leprosy and shit. They have larvae, they don't have eggs. It's they're able to transmit more easily. I think the mammals think their shit.
I have to
Those their
inmates
shit, bro.
caught committing one of those infractions.
Okay, get 'em.
And their default, because of whoever they are, is a resort to violence. Does that cause any violence?
Yes, it
I
does.
wish I could see his dead body though.
To your question, go ahead.
Is that the same thing you described for somebody who reacts to stress and change? Is that the same kind of thing?
Yes.
Now, kind of spelled a couple of myths here. Is it true that there is a typical predator versus prey person or inmate in the prison system? Is that true?
There is no mold for me or anyone in a correctional setting to say this person will or will not be a predator or prey. No.
You just can't tell.
It is case by case. Yes, sir.
Now let's talk a little bit about, I talked about the
Sure.
and where is it located?
I was a captain over death row at that facility. It is in Livingston, Texas.
And so let's talk about a little bit of differences here. With regard to housing at the Polinsky unit in Livingston, is it the two different types of housing that we have in the normal prison system, or is it one type of housing?
It is different and is one type.
And then with regard, I'm going to ask you some of the similar questions here. With regard to the movement of inmates within that unit, how does that differ from regular, say you're a G2 or G3 inmate serving time?
So, like I explained earlier, for that movement going to and from the dining hall and things of that nature, there is nothing like that within the death row environment. So, anytime before someone is going to be taken out of their cell within death row, they're completely searched, strip searched. They are then they redress, restraints are applied, the door is open, and they're escorted out of their cell with two correctional officers at all time, taking them where they need to go, and they remain restrained the entire escort.
And I'm going to kind of go through this quickly here. Is that the same for transport, medical, things of that nature? Does that remain the same for that?
Yes, transport's completely different. They will never be on a bus. Anyone assigned to death row is going to be in a van, a secure van by themselves with vehicles in front of and possibly behind, following and chasing that vehicle. Much higher level of security oversight for types of transports. For your question about medical, someone in G2 and G3, they get essentially what you and I would know as in a doctor's appointment, right? They get a little slip with their time, they show that slip to the correctional staff, and they walk down to the unit medical department. In contrast that with death row, those individuals again are restrained and escorted to that medical appointment. There's no one else around, the hallways are cleared, and that staff remains with that individual the entirety of the medical or mental health appointment. So they are not going down there alone.
We talked about structure, routine, and change. Talk to us about the difference between structure, routine, and change between normal prison unit and the Valencia unit in Libby's.
Sure. So death row by nature is far more structured.
Hey, that's the shit right there. That's how they're gonna help it. They're gonna try to get it with that, you see? Because the defense keeps harping on the fact that he has problems dealing with changes. He needs structure. They keep saying he needs structure with his disabilities because he can't handle change very well. He freaks out, man. And they're like, well, if you want structure.
It is, they remain at that facility for the entirety of their incarceration up until that sentence is carried out. The structure of their movement is much different, as I just explained. So it is very different compared to the general population movement. The living area, they are in the cell by themselves. There's not a cellmate that's assigned to their cell. So everything about it is far more structured and a lot higher level of management and oversight.
And some of the jurors might start having a light bulb moment right now where they're like, oh, less structure, more likelihood of vigilante justice. They might want it.
Let's break
This is
lunch,
common
okay, and we'll
sense,
start
ain't it?
up at 1:30. All right, see you then.
Because if you look at the O.J. Simpson case, there were jurors that said not guilty because of the Rodney King trial, because of the Rodney King incident. They admitted it years later, and so there could definitely be jurors in this case that are just going to say, no, I want him to go to Gen Pop because I want vigilante justice. That's such a big possibility. All right, so we're going to skip this entire break, which was like an hour. But then the people came back and talked and everything. Hell no, lady.
We're not gonna hear from Tanner Horner's brother. Okay, so,
Tanner Horner walking back in, he sits down, he looks like a
they have
pedo.
TV and tap.
Well, apparently he's not a pedo though, because he went, no, he is a pedo. This one is a pedo. Yeah, that age group is a pedo, but him going after the 16-year-olds wasn't a pedo offense, is what they were arguing at one point.
Imagine.
So they're saying, actually, the defense, professional witnesses were saying that he's not a pedo because he doesn't show a pattern of it. He only did it the one time.
Each of them gets a TV in their cell for sure.
Yeah, I don't
and
know.
I don't know exactly what limitations they have, so I'm not aware, not sure about
I would
that.
not consider myself an expert on death row. I mean,
Yes.
I've witnessed a couple of executions in my career.
Well, they
were
definitely got a
pre-COVID.
TV in their cell, dude.
But both of them were cop killers.
What are they trying to say?
And,
Don't put on death row because he gets a TV?
It's very interesting. I don't even know how to describe it.
Get him in
That
there.
room,
Shut up,
that
lady. You
room.
guys suck. God, they suck. I don't like our manner of speaking. I don't like your manner of speaking,
This is my CV, sir.
Sure, for a copy of your CV.
Yes, it is.
Okay, does that reflect the things you talked
regard to work in the prison system.
Yes, sir, it does.
This is under RPC 310.
Good afternoon.
Good afternoon.
Good to see you. Now, just saying, ask you some questions based on your prisoner. Not in no way that is violent, and God forbid you transport them to us, but they're just free. That's not accurate, is it?
No, sir, that's not accurate.
Now, what's your top priority, I think, for your division?
Our top priority as an agency is public safety. That is our number one core function, is providing the safe incarceration of individuals in Texas and protecting our citizens.
And that also includes the safety of the staff, the visitors, and the inmates.
That is correct.
Now, let me clear up a couple of things. You went there pretty quickly on the Wyndham School District contract for education. Nobody's going to a school, right? That's them educating the prisoners.
That is correct. They come into our facilities and they have a campus essentially inside of the prison walls, and that's where they conduct their educational services. They also do vocational services, so they might be able to learn how to be a diesel mechanic or things of that nature.
And talking about inside the prison walls, a G3, which is anyone that's over 50 years, would include someone with life without parole. That means they're restricted to living within 4 concrete walls, right?
They are within the walls, yeah. It could be concrete, it could be fencing, but yes.
And they're not allowed to live out at a work camp or anything like that?
That is correct.
And when you talked about working outside, you meant outside the building, not outside a prison facility?
They could do both.
A G3 could?
Yes, they could work outside the secure perimeter in a what we call a field squad.
Sure.
They would be under direct armed supervision.
Now, you talked about being 104 prisons. How many can house a G3?
34 of those prisons within the state they're designated to house G3 custody.
And you talked about your division is in charge of transport too.
That's correct.
And you do safely transport prisoners all the time, intake to different facilities, that sort of thing.
Yes, sir. That's one of our missions. Yes.
Now I want to look back up and talk a little bit about some of the things we've talked about. How many employees does TCDJ have?
We have around 34,000 employees throughout the state.
And how many inmates do we have approximately right now?
This morning, the count was 142,464 incarcerated.
And it's your job to determine, your division, I guess, not you personally, but your whole division's job to determine which facility best suits the needs of an inmate.
That's correct. That is one of our goals.
And that's an ongoing process throughout their incarceration.
That's correct.
So when we're talking about reviews every 6 months, that's not because you're looking to be easy on people who are turned loose. That's because you're wanting to be current.
That's correct. That 6-month time frame was more specifically geared towards when someone gets a disciplinary infraction.
Sure.
But there are many reasons why someone could receive a classification review. It could just be because they've been accepted into a new program or things of that nature. So it is very fluid, and it does change often.
Now let's talk a little bit about that. Your that determination involves more than just security, right?
Correct.
And what are some of the other things you're looking at?
Some of the biggest driving factors behind classification and placement is going to be their medical needs.
Mm-hmm.
So, for instance, if someone has needs dialysis, well, that 104 prisons becomes much smaller on the options that I have on where to send and place somebody. Their mental health needs, their treatment needs, programming needs. So classification is surely a dynamic process of systems that encompasses a lot of different correctional professionals, medical professionals, all giving input and using tools to best assign someone where they fit.
Now, I think when we talked before, you said for the individual inmate classification, you're using a holistic approach.
That's correct.
And what does that mean to you?
So holistic, that's going to mean it's not just based on their sentence. It's not just based on their charge or their crime. We have to look at many factors. Some of them I just mentioned, right? Their medical needs, treatment needs, their criminogenic history, their demographics, their age. We look at all of those different factors and find the best placements for them around the state.
And for example, you mentioned before about how they've behaved in other facilities. An example of Tanner Horner, he's been in 2 different jails. That's something you would want to know and what happened, right?
Sure. At the beginning, I talked about the intake process.
Yes.
And so when a county sentences someone or a court sentences someone to prison, the county has to provide what's called a penitentiary packet, or PEN packet for short. One of the documents that has to be included in that packet when it comes to the TDCJ is a jail conduct history. So yes, I surely need to know what that conduct was like in the jail leading up to their transfer of custody to the TDCJ.
And you mentioned before, are all of your staff non-uniformed in your division?
No, sir, because I also oversee inmate transportation, so we do have a large portion that are non-uniformed. We have a couple of hundred that are uniformed.
It's a couple hundred out of, is it roughly 2,000 in your division?
Correct, yes, sir.
Now, when someone is convicted of capital murder and sentenced to life without parole, where would they go for their intake?
Say it again, where would they go?
Where would someone who's convicted of capital murder, given life without parole, where would they go for their intake?
We have 5 main intake sites around the state, geographically located based on the county. So we have a facility in West Texas called the Middleton Unit. It's in Abilene. We have a facility up near Palestine, Tennessee Colony area, the Gurney Unit, the Holiday Unit in Huntsville, the Byrd Unit in Huntsville, and then for South Texas, we have the Garza West facility that's in Beeville. So an individual sentenced to life without parole, depending on the county of their sentencing, we would schedule them to the closest facility for intake.
And that's not all the facilities you have for doing intake, correct?
No, we have other facilities that do state jail and probationary type intakes, but those are the main institutional division intake sites.
And so those 5 will have the training necessary and expertise necessary to do that classification on someone who's convicted of capital murder and sentenced to life without parole.
That's correct.
We talked a lot before about the 2 different ways that they could preside, either with a cellmate or in a dorm. And some of those dorms are pretty large, right?
Yes, sir.
And that persons who are G3 would have access, there may be volunteers, there may be staff members, things like that, that they could have contact with, correct?
Yes, sir.
And obviously it's your belief that they can have that contact and you can still maintain safety for the public, for the staff, for those visitors, for the other inmates.
That is correct. That is the goal of the correctional staff on those facilities, is to provide those opportunities for folks that are trying to better themselves and trying to have a positive adjustment while in prison. One of our foundational missions outside of public safety is rehabilitation, because that directly impacts public safety. The vast amount of our inmates are getting out at one point. Last year we received 56,000 new inmates. We released 50,000. So those people are going to go out and live next to you and I. Again, based on their sentence.
Do they have to?
So our goal is going to be rehabilitation, right there beside public safety. And so yes, we will do all we can to get them to those programs and make sure that those go as smoothly as possible.
Let's revisit a second. I know you talked about movement around the facility, and it sounded a little willy-nilly. That's not what authorized movement means, is it? What does authorized movement look like for an inmate? Say a G3.
Sure. So there's different reasons why they can move. So they could be coming out with a group of individuals going to a work assignment. They could be coming out and going to a program or to a meal. So there's different reasons why they can move in groups. There's also many reasons why they can move individually. So that example I gave earlier about the medical appointment, they wouldn't necessarily be going in a group. If just that one individual had an appointment, they would show their slip essentially, and the officers would let them out, and they would walk through the hallways to go down to where their appointment was.
Is that what we mean when we say there's either mass movement or they have a path to go somewhere?
Sure, yes.
Now, as part of that classification process, do the inmates receive a complete medical workup?
Yes, that's happening in tandem with the classification process. So during intake and then afterwards as well, they see nursing staff, they see medical providers, and then their electronic medical record is updated by the university partners, the medical partners. And when the EMR, the medical record is updated, that feeds into our inmate management system. And so we can see the vital data that we need. We're not going to see, for instance, someone's diagnosis, but we would see if someone, say they need a bottom bunk because they can't climb into the top bunk. So we would see different living and work restrictions that would impact how we assign people.
Okay. And in those 34 facilities, you're able to make those accommodations?
Yes.
Now, did they also receive a mental health workup as part of the classification process?
Yes, sir. Again, not as far as the classification process, but it's happening simultaneously.
Okay. So that happens, and that gives you data to rely on in doing the classification?
Correct.
Okay. So let's describe that quickly. So you described the medical uploading their information, and there was a medical exam as well?
Yes, it was different medical evaluations, and they put that information into the electronic medical record, and then out of that, our system pulls vital pieces of information that could impact their housing or job assignments. Same thing with mental health. So for instance, if someone is in a crisis event or has some kind of critical mental health need, the mental health providers might tell us, well, that person needs to be assigned to a specific inpatient program, which would give them a certain psychiatric score, is what we called it. That would then tell us that individual can't live on certain units, they can only live at inpatient mental health units, as an example. There's other things far down that spectrum where it might just say, well, he or she is taking medication. Well, that medication is not going to dictate where they live.
Okay. So that's both an exam and I assume they're looking at mental health records?
Yes. Yes.
Now, is G3 the minimum classification for someone who convicted of capital murder and serving life without parole?
Yes, that is the minimum.
So they would never be in G2?
That is correct.
What is institutional adjustment?
The way I like to best describe that is when they arrive to the institution, how well do they manage that change? How well are they interacting with other inmates, with the staff, with volunteers, anyone else around them? Are they complying with rules and regulations? And ultimately, are they making the most of their time, or are they going down more of a negative path and violating rules and regulations and getting themselves into trouble? So it's how they are adjusting to prison life.
But once again, are you looking at how the institutional adjustment on the county level too? Is that something you take into consideration?
We do evaluate that during intake, yes.
And we talked about when someone gets downgraded to a G4 or G5. Those inmates would receive additional restrictions, I think?
Yes, sir.
And you talked about you have different restricted housing available. Do you also have safekeeping housing available?
We do have safekeeping, yes.
How does that?
So we have a small portion of our population that's in safekeeping. They still are in a cell block environment with cellmates. But we have a very robust Safe Prisons program and a PREA program, which is the Prison Rape Elimination Act. So you have a lot of different factors that go into evaluating someone's potential likelihood of being a victim within prison, or the fact that they have been victimized. We evaluate all of that, weigh it out, and then if the committee, again the UCC committee, that 3-person panel, decides that someone is in need of a higher level of safety or safe living, they could be placed into safekeeping status. They're still in general population buildings. They are just not in a general population living area. They're separated. They can still have jobs and go to the dining hall with other inmates and all those other examples. They just live separately.
So that could be within those 34 facilities we're talking about?
That's correct.
Let's go a little bit bigger picture now. Is there guidance available for how to manage and maintain a prison classification system?
Yes, it is. There is many different guiding policies. and evidence-based practices that guide classification.
I believe we talked before about the National Institute of Corrections had some guidance from the federal level.
Yes, the National Institute of Corrections puts out federal level regulations and things of that nature that, depending on what that guidance is, could or could not influence the state of Texas policy and classification.
Obviously, Texas may have some of their own guidance from the legislature, that sort of thing, correct?
Correct.
Now, are you able in your role in your division to take that kind of guidance and then build on it to be consistent?
Yes.
And how often are you updating policy procedures to try to make this a better system classification?
It's frequent. There's many different standard operating procedures, policies, and plans. It's kind of 3 different buckets of information that are reviewed frequently. They could be updated because of new technology. They could be updated because of new, again, evidence-based data that shows us we might need to move in one direction or another. We look at different genders and how we're classifying females versus males. So there's a broad spectrum of changes that can and do happen throughout the years to make sure that we are providing for the mission of our agency, and that's protecting the public. And so we do not want to stay stagnant. We always want the most informed decisions guiding how we play out our mission in the state.
That was going to be my next question. And I assume when you talk about prison being kind of a city, a secure city, you're also looking out for everyone within that city.
That's correct.
Now, I guess this is kind of obvious at this point, but you talked about someone on death row is obviously going to have less contact with everyone in that city than the other inmates, right?
That's correct.
But your division's job, as part of what you're doing, is trying to make it as safe as possible for those people who aren't on death row.
Yes, to the
You
extent.
have that additional freedom.
Sure, to the fullest extent possible, yes.
What's a classification profile?
So the way that I like to describe that is this happens during the intake process, and then it never stops. So when someone comes into our custody, whether they're a first-time offender or if they've been with us multiple times, we are going to build a profile that works to encompass everything that we can about that individual. The idea is that down the road, the operators in the field have a good sense of everything about this person's history. So we go through family background, jobs, whether or not any kind of gang affiliation, any prior arrests, whether they did or did not lead to incarceration. So we try to gather as much as we can. There's a bunch of different assessments that happen that guide treatment. So IQ tests. We do an adverse childhood impact evaluation. We do the Texas Christian University drug screenings. So there's a bunch of different tools that are used during intake to build this foundational profile about every person that comes in our door. And then throughout their incarceration, that profile is constantly updated, again, based on that institutional adjustment. So how they're behaving, things could change from day to day, and that needs to stay current.
And is that information useful in fulfilling your primary goal?
Yes, it is useful.
Now, we talked about, I mentioned a second ago that the prison is kind of a city behind the walls, but this is a city that has 24/7 security, right?
Yes.
And the inmate movement is restricted.
Yes.
And the staff members are properly trained.
Yes.
And the civilians who enter are appropriately screened.
They are screened, yes.
So, in your expert opinion, is the process that you're using a reasonable and effective way to house someone who's been sentenced to life without parole while ensuring the safety of the public, your staff, the visitors, and the other inmates?
We do all we can to provide for the safety of the staff and for the public, so yes.
Recorrect. All the same exam processes that we went
Wednesday.
through and talked about.
That'll be your
with regard
Wednesday.
to someone serving life without parole in the
Wednesday.
prison system. That does exist in the Valinsky unit and death row.
Not Tuesday.
Yes, sir.
Okay. And you talked a little bit about your goals and what do you use to be effective and provide a safe and effective place. But regardless of your goals, Does violent conduct against staff still occur?
Again, just like the society analogy, we have laws to prevent violence against citizens. When you are dealing with a prison environment and a
Looks like I'm
society
opening
that's
the new
built
one
up
then.
or made up
Because the other one hasn't even shipped
hundreds,
yet.
if not thousands, of convicted
After
felons.
tomorrow though, new
No matter
headset.
how hard we try as an agency, we still have violence and concerns within prisons.
Is that your same answer when it comes to potential violence against volunteers that have been screened and in your prison system?
Yes.
That's what
Mr. Goble?
Couple of quick questions. For the G3, are there any incentives for housing like that?
There are some incentives. So again, this goes back to the conversation of parole eligibility and hope. And so when I talk about hope within a prison, hope is a very intrinsic thing a lot of times. It's hard to tell who is going to act out because they do not have any hope.
Hey,
So we
this
have,
says, welcome
as an agency, an obligation to try to incentivize someone who may not, in other words, have any incentive because they might not be have a parole eligibility. So we do have some certain living environments within some of those prisons where if someone does not get a disciplinary case for X amount of years and they show good behavior and they're working hard at their job assignment, they might be able to live in an incentivized dormitory. But they're still within those 34 maximum security prisons. It's just certain dormitories within those prisons.
Right. So there is positive reinforcement for even someone who sends to life without parole.
Yes, that's correct.
And I guess specifically it's already been testified to that Mr. Warner had no disciplinaries at the Wise County Jail or at the Tarrant County Jail. That's something your division would take into consideration in building his profile.
Correct. Up until the last day of his incarceration in the jail, and then leading up to the transfer to our custody, we would get that up until that very last day, and the county would let us know his behavior.
That's what it's
Mr. Taylor? That's what it meant. May this witness be excused?
Very good boy.
Yes, sir.
Thank
You ready for your next witness?
Yes, Judge.
Okay.
I was too late for jets. I didn't know they were here. I'm sorry.
Yes.
That's pretty fast though, dude. I thought it might not get here till Friday. This is said expected delivery Wednesday, dude, by 9 p.m. Could have a new headset, brand new, sealed in the box, with a 3-year warranty for $200. Good deal. Pretty good deal, actually. Not bad. Sealed, box is sealed and everything, never been opened. Plus, I got the other one on the way for $37.57 with shipping and tax. I don't know if that's with tax. How much was it total? Complete total $37.57, but it's a headset only. But it looks like it's in decent, really decent shape. What I can do is I can take this headset that I'm getting, take it out, leave all the other stuff in there, put this headset in with it, and sell it as an open box unit. Yeah, baby, and maybe even make all the money back. I could do that, or I could just hold on to it and as an emergency headset.
Okay. Do you want me to go through, I don't know how much they want me to go through the questioning. You want everything that I'm going to ask?
Well, you'll have to have enough evidence to
Well, yeah, just,
that it's admissible.
it doesn't have.
It'd be nice to have the headset again working correctly.
Issue, but enough for me to determine whether or not it could be proved beyond a reasonable doubt.
We're going to, for purposes of the record, we're going to call you Billy. We're just going to use your first name, okay?
Can you
Okay.
move closer to the microphone?
It was Billy.
Yeah, make sure you speak up. How do you know Tanner Horner?
I know Tanner Horner because my uncle had a baby with his mom, and I was raised as his cousin.
And so how long have you known Tanner?
Since I was 3 years old.
Was there a time when you lived on the same property as Tanner Horner?
Yes.
Do you recall about what time frame that was?
2000 to 2004.
And after around that same time period of 2003, 2004, was there some type of sexual assault incident that happened to you?
Yes.
And can you tell us what that is?
It was a sexual assault down by Lake Worth, right down the street from Tanner's grandmother's house.
And
Do I need to go into detail?
so, and that was, what location was that though, specifically?
Just to the right of the boat dock off into the trees right there.
And yeah, can you tell us, you don't have to give the full version, but what happened to you there?
He went back there, he pulled out his penis, he started masturbating. He told me to suck it, and then he grabbed my head and made me. And then he told me to bend over, he tried to put it in, it would not go in. And then he told me to continue sucking, and then he pulled out and finished by masturbating.
And did you tell Tanner no, or did you go along with it? What happened?
I was scared of Tanner. He was bigger than me. He's beaten me up before.
Wait, Tanner did this to this guy? What?
I went along with it.
And after that point, was there a different incident that happened to you?
It was later on around 2007 when Paranormal Activity first movie came out. I woke up to him masturbating above my head. He pretended that he was asleep. I moved out the way, yelled several times, and he just kept on doing it. And then I waited till he went back to bed, and I laid down and went back to bed.
After these incidents, did you ever hang out with Tanner and one of his best friends, Cody?
Yes.
They hung out again?
Can you
What are you doing?
recall anything about
I
that?
liked it. At this
It was
point.
4th of July.
Homie, your friend just started to stick his dick in your ass at some point and told you to suck him off. You're continuing to hang out with him. You wake up as he's beating off above you. Y'all go back to sleep. You go back to sleep there. Okay, that's weird. And then he hangs out with him again after that. I'm sorry, dude. You guys had some kind of weird thing. You liked this weird shit, bro.
Tanner's grandmother had parked her van at the fireworks stand. It ran out of gas because I guess she was sitting on a hill. It wouldn't start. It rolled back. Cody gave us a ride home to his house, and in the car on the ride home, Tanner had mentioned he'd wondered what it would be like to kill somebody.
How old were you about that time?
That time I was older. Had it been 2008 or 9.
And so that first sexual assault was around 2003, 2004?
Mm-hmm.
And the second sexual assault was 2007?
Mm-hmm.
How old were you at those times?
2004, I would have been 10 years old.
And 2007?
Let's see. 13, 14, somewhere around there.
And then this other event was in 2009 when he made that comment.
Mm-hmm.
Jeez, he was a kid.
And how old, what is the age difference between you and Tanner Horner?
About 3 years.
He was talking about killing people when he was a teenager?
Have you spoken to anybody about these sexual assault incidents before?
Yes, before the trial started, I spoke to the defense.
How many times?
Once she came out to our house. It was warm outside. I believe my kids had just started back to school. And she was in a white SUV, tan overcoat, and tan pants.
And did you have a phone call with anybody from the defense as well?
Yes. It was 2 to 3 weeks ago.
The defense.
In both of those conversations, what did you tell the defense? You don't have to go into detail, but.
The first one, I told her about the sexual assault. And the second one was over the phone. She initially called my mom, and I told her about the sexual assault when I jumped on the phone with her.
That's what it's judge.
Cross-examination.
Now, there were some different dates there when you were answering those questions. Can you help me out? In the notice you received, it talked about the first incident being between 2001 and 2003. Does that sound right?
2001, 2003 would have been when he set the hay bales on fire and started a fire in his backyard.
That's when you were living at Risinger Road?
Yes.
Okay, so this would have been after that when he moved back to Jackie's?
Yes, around 2004 is when I moved off the farm. He was back at Jackie's.
Okay, and the second incident, is 2007 accurate for that?
Yes, it was the same year the paranormal activity came out because Melissa rented it from the Red Box.
So the 2004 incident, you two would have been what ages?
2004, I would have been 10 or 11. He would
You would
have
have
been.
been 12 or 13?
Yep.
Dude.
And then the 2007,
That's so
you'd have been
crazy that,
13 or
like-
14, he'd been 15, 16.
Yep.
Horny ass kids. What the hell?
And the statement about wondering what it'd be like to kill somebody, you said that was 2007?
That was around 2007, 2008.
Okay. So once again, he's 16. Ish.
Yep.
Yes. Okay.
And did you speak to your mom or anyone else about this incident?
No, I never told my mom about the sexual assaults or any of that.
They might have, like, I don't know, acted like they were boyfriends or something.
Okay. Now, when you say you spoke to the defense, you don't mean Susan, right?
No, over the phone call the second time, she named herself Shawnee.
And was your mom present for either of those conversations?
Yes, my mom was present for the phone call one, and my mom was present for the one where she showed up in the house. I just happened to be at my mom's house when she showed up.
And what made you decide to come forward now?
The fact that he killed the kid and the truth needs to be told.
Well, there you go.
I talked to defense and I told them many times I wanted to speak to the prosecution, and they never got me in contact with the prosecution, so I posted on Facebook.
You said many times, you said you spoke to him twice?
When I spoke to the lady the first time, I told her I wanted to talk to the prosecution.
Okay.
She never got me in contact with them. When I spoke to Shawnee, I told her I wanted to talk to the prosecution. She never got me in contact with them. So I went to Facebook,
would they?
and then the state contacted me off of Facebook.
Right. You posted on Facebook, and then Ranger Espinoza called you, came to see you. What happened?
WFPD Wichita Falls Police Department left a card at my door, and I made the choice to make the phone call to the Ranger Espinoza.
You're not a past witness.
Ray, correct?
Nothing for the right now, Judge.
Any objections?
Here, I'd object on the grounds that basically surprised, even the last supplemental information we had different dates that he's testifying to here today. This witness was not, we've had a long extended time to deal with extraneous acts. This witness was not noticed us before the trial started.
Those objections are overruled. He'll be allowed to testify, and you may have a running objection to his testimony throughout his testimony. Both sides ready for the jury?
Ready, Judge.
Let's go.
It's so loud all of a sudden.
And how are you related to Tanner Horner?
My uncle had a baby with his mother, and I was raised as his cousin
So how long have you known Tanner Horner then?
since about 3 years old.
And during your childhood, were you around Tanner Horner a lot or a little?
I was around him a lot.
And what did you guys do when you guys were around each other?
Usually playing, he liked to pretend play Dragon Ball Z, and it ended up him just beating us up. Throwing rocks in the rivers, creeks, out there on Rising Road.
Was there a time when you guys lived on the same property?
Yes,
And what time period was that, roughly?
2000 to 2004.
After 2004, did you have any contact with Tanner Horner at that point?
Yes,
And where was Tanner Horner living at that time?
at Jackie's house in Lakewood.
What got you into contact with us, the state, in this case?
The fact that I told the defense I wanted to speak to the prosecution, and out of impulse, I made a Facebook post.
You made a Facebook post. When did you post that?
I posted that uh, 2 to 3 weeks ago.
And what did you post?
It was a post about, let's see, zero fabricated. Tanner Horner sexually assaulted me and basically beat me and Nicholas up as children.
And when did you meet with the state prosecution for the first time in this case? Roughly.
26 of last month.
So, of April?
Yeah.
From that Facebook post, you just mentioned that there was some type of a sexual assault. I'm going to ask you a few questions about that, okay?
Yes, ma'am.
All right. The event that you posted about, and you don't have to be exact on dates, okay? But do you know about when that first incident happened?
The first sexual assault? The first sexual assault happened right around 2004.
And where did that happen?
Down the street from Jackie's house, Lake Worth Lake, by the boat dock, off in the wooded area.
And you say from Jackie's house. How far away from Jackie's house is this boat dock?
Not even 5 to 10 minutes.
How did y'all get there?
Walk.
So it's a 5-10 minute walk.
Mm-hmm.
Did you guys go there frequently before this, or have you been there before?
Yeah, me, him, and Nicholas would always go play at the park, go down to the lake, climb on the rocks and all that stuff. They had piles of sand out there. And then one day, Nicholas didn't want to go with us that day.
I said Nicholas knew it was going to happen
How
or what?
old are you at that time? And then how old is Tanner Horner at that time?
I would have been about 10. Tanner would have been about 13.
So Tanner Horner is about 3 years older than you.
That's crazy, dude. He was sitting here trying to, bro. This shows that he is
At this time,
like
is
a predator.
Tanner bigger or smaller than you?
He was bigger than me.
Can you go ahead and tell the jury what happened on that day?
It shows there was a pattern.
About the whole sexual assault?
Yes.
Alright, it started off as we were all gonna go play down at the park as usual. We ended up walking down the street. Tanner wanted to go to the boat dock. We ended up going off into the little wooded area of the boat dock. Tanner immediately pulled out his penis, started masturbating. He told me to get down and start sucking it. I was scared of Tanner at the time, so I did. And when a little bit of time goes by, he tells me to bend over. He tried to put it in. It would not fit, I guess. So he turned around and he had me suck it some more. And then he finished by masturbating next to the tree.
Bruh. At 13 years old
At this
to
point.
a 10-year-old.
Why were you scared of Tanner at that time?
Because he would like to pretend play Dragon Ball Z, which ended up him just beating us up and kneeing us in the stomach.
And
I was scared of him.
the us, was that his brother?
Mm-hmm.
Oh, no. Hold on. I've been scared of people before. I've been scared of kids before in school. I've known some kids were bullies or whatever. There ain't no goddamn way I would have sucked their cock and let them stick their dick anywhere near my asshole. You know what I'm saying? Something seems off here.
Was there another sexual assault incident?
Yes.
And again, we're gonna kind of, I know dates sometimes are, but do you recall the date on that sexual assault incident?
The same year Paranormal Activity came out, the very first one, 2007. He woke up to him masturbating above my head. He pretended like he was asleep. I backed off in the corner. He continued to act like he was asleep, then he laid back down, covered up. And I just stayed there until I made sure he was asleep, and I went back to sleep.
Yeah, why would you stay there? Like, who does that? Who stays there after that? Like, yeah, whatever.
Now,
It's Tanner being Tanner.
at this point, I think you were probably around 12, 13 years old,
Mm-hmm.
and with the 2007 incident.
Mm-hmm. Yes. Yes.
The court reporter has to take down all your answers.
Sorry.
No, it's okay. So just say yes or no.
Yes.
So after these two sexual assault incidents that happened to you, past when you were 13, did Tanner Horner ever sexually assault you again?
No, he didn't sexually assault me again.
He likes them young.
After this point, though, did you still have some contact with Tanner Horner?
Yes, I got dropped over there to hang out with him.
Why?
My parents were going through their own issues.
Why would you do that?
And was there an occasion where you hung out with Tanner and his friend Cody?
Mm-hmm.
And can you tell us about that?
He hadn't testified as to anything said. Don't testify as to what other people told you. You can testify as to what happened.
Testify to what I heard, right?
No, you can't do that. You can only testify as to what you saw.
I saw directly from Tanner.
Rephrase your question.
Can you, when you hung out with Tanner and his friend Cody, did Tanner Horner make a statement to you?
Yes.
Oh, really?
And what did Tanner say?
Tanner said he wondered what it would be like to kill somebody.
How do you remember that statement?
It triggered in my head when he actually did kill somebody.
And do you recall about when this happened?
It was 4th of July. It had been after 2007, so about 8 or 9.
So 2008 or 2009?
Mm-hmm.
How old was he then?
The sexual assaults that you posted about you just told us about. Who else have you told
He was a
about
kid,
these?
dude. Talking on one
Connection relevant.
Sustained.
That's crazy though.
No, hold on. She'll ask you a question.
Now, Billy, in 2015, did you?
Dude, I got picked on so hard in school. Watched all kinds of crazy horror movies. Played all the fighting games with all the gore and the blood and all that shit. And I never thought like that. I was brought up differently, I guess. If anything, I thought about how I wish I would just fall asleep and never wake up. I wasn't thinking about taking anybody else out.
Did you get arrested and ultimately convicted for a solicitation of prostitution charge?
Yes.
That did not involve a child, though, did it?
No.
Have you ever kidnapped, sexually assaulted, or murdered a child?
Connection relevant.
Sustained.
I'll pass on this, Judge.
Cross-examination.
Billy, I have a question for you. The school records show that Tanner moved back in with Jackie in 2002. Would that change the dates we're talking about for you?
I guess I'm going off my memory.
Okay. So if he was in the Azle School District in 2002, then we back those years up a couple years. Would that still fit your memory? Would you may have been? What does that make you?
Maybe
8 or 9, and him 10.
Probably, yeah.
Something like that. 10, 11, something.
Damn, that's even worse.
Now,
what? He was 10 trying to stick his dick in people? Where did he learn that?
now the second incident when you two were teenagers, there was no physical contact.
No physical contact.
He was molested. That's how he learned it, probably, dude. Dude, it's crazy.
Now, you said that
It's like a contagious
you-
illness.
Tanner, you're not blood relative. You're related through his half brother.
Yeah. Yes.
And your family and his family, before he moved back in with Jackie, rented houses on a farm.
Mm-hmm.
Separate houses.
Yes.
So that's why you were around each other so much then.
Yes.
Now, at that time, when you and Tanner were forced to hang out a lot, were your parents struggling with an addiction?
Yes.
And Tanner's mother, I guess her boyfriend at the time, your uncle, were they struggling with heroin and meth addiction?
Yes.
And did you tell, I guess you stated to Ranger Espinoza that Jackie was too busy dealing with those addictions to actually raise Tanner and his brother?
Yes.
Is that how you felt?
That's how I felt.
Did Tanner witness
Alright.
Tanner's mother chasing your uncle out of the house with a butcher knife?
Yes, it was me, Tanner, and Nicholas all put up a tent in the living room, and Melissa comes through chasing Eddie out the house with the butcher knife.
Okay, so
That was on
that.
Rising Roof.
And after that is when Tanner moved back in with his grandmother.
Mm-hmm.
Did they get evicted?
I'm assuming so, yes.
Now, in the time that you knew Tanner, was he ever depressed?
Not that I know of. He was just over energetic.
That doesn't mean
What about
anything.
suicidal?
There was one time in my life when I stayed the night with him, and I woke up to Jackie taking him to the mental ward for a suicide attempt.
You remember, was that overdose or cutting? What was that?
I believe it was right after he got his shack, is the bedroom in the backyard.
Give me 1 second. I think you said that the last contact you had with Tanner was in 2018. You helped him get a job.
Yes, I got him a job at all my son's moving and storage.
Absolutely, Mr. Your Honor.
Pretty direct.
Very briefly, Judge. Seems like the dates may be a little foggy, but is what Tanner Horner did to you, is that clear in your mind?
Yes.
Why come forward now?
I figured the truth needs to be told. He deserves to pay for everything that he's done.
Objection, Your Honor. Court ruled on this in a motion limited.
All right. Sustained. The jury will disregard the last statements.
I'll pass the witness, Judge.
Mr. Coble,
Nothing further.
may this witness be excused?
Yes.
Yes, Judge.
Thank you, sir. You go with the plan. I gotta do one more thing outside your presence, okay? So let's take our afternoon break.
What the fuck? Why is the judge so fucking ignorant when it comes to mic presence? Fucking ear rape the hell out of everybody constantly, dude. You're being broadcasted internationally, probably.
Hearing with the witness, so, Ms. Anderson, I'm gonna let you go first.
Dr. Randall, how are you?
I'm good.
Dr. Randall. You spoke, or actually since you wrote your report in April of 2026,
Yes.
what records have you received?
Numerous reports by your expert witnesses. Some of the notes, I didn't review all of them. The handwriting, I think, of Dr. Ryan was not as bad as mine, but I had trouble reading it. And then, let's see, I looked at the testimony from Cassie as well. And then I just listened to Billy's testimony today.
Did you listen to any of the experts who testified in this matter?
Briefly, there were two that I was able to follow about an hour each one.
Who was that?
The first one, I think it was Dr. Speck. I'm not sure. He was from A&M.
Dr. Evans?
That's it. That's him. Yes, sir. He might have been the first witness you had. And then briefly, Dr. Ryan last week sometime when she was on direct.
Based upon, and which, you said it was an interview with Cassie. Which interview?
Was that not an interview? It was I guess court testimony from Cassie Wyatt.
Okay, do we know, was it her civil deposition? Was it the hearing that we had in this court? Which hearing are we talking about?
It was, as I put together, related to this case, so not the civil suit. I didn't know there was one.
Oh, let me ask you this. If when you looked at the transcript of that, were there lots of black lines on certain pages?
Yeah, there were some holes. I can't say that I remember big black lines standing out, but there were holes. That's the best what I remember.
Okay. What do you mean when you say holes?
In other words, it wasn't confluent. There were gaps, so to say.
So wasn't the complete transcript?
It looked fairly complete except for maybe some omissions or things that were either not transcribed or something like that.
We had a hearing that began in December of 2025 and continued in April of 2026, wherein we discussed your testimony and your findings.
findings. Do you have any additional findings or conclusions in addition to the report that you've already produced?
Yes.
And what are those?
Based on me looking at the records again, I remember that hearing where I hadn't reviewed that, and the expert reports, the transcript, the testimony today. I do have an opinion regarding future danger.
And what is that opinion?
That based on the evidence, there is a probability that Mr. Horner will commit violent acts and constitute and be a continuing threat to society. I think I'm paraphrasing the statute, but I don't remember it by heart.
What do you base that on?
On the statute. It has to do with the statute regarding future dangerousness in sentencing hearings.
I understand that, but I'm asking upon what evidence are you basing your opinion that constitutes a continuing threat?
So previously, I expressed concern about his temper, his ability to control himself, the outbursts he had. I think I mentioned his attitude towards women in general, based again on the audio recording that I listened to regarding his mistreatment of Athena. And then after looking at the rest of the reports that from the experts you provided, it was clear that he had some issues with executive dysfunction, difficulty with emotional processing, self-regulation, basically anger, so to say, and that he was also impulsive. And so because of their reports and the evidence they provided in those reports, coupled with my concern already about his ability to manage stress, control himself, his behavior, and particularly keeping in mind what I heard regarding what he did to Athena, that was the basis for my opinion.
Are you going to render an opinion on any particular diagnoses that you feel would be appropriate for Mr. Horner?
Well, if anyone asks me, sure.
What diagnosis?
Okay. When I submitted my report, I had reviewed records that covered approximately 20 years of his life, perhaps more than that. And based on that information, I rendered diagnoses of depression, anxiety, long-standing. I didn't point out in the previous hearing that, for the records, major depression recurrent was something that came up, unspecified anxiety. There may have been some features of panic attacks, but nothing was really codified in a diagnosis. Additionally, and I think I stated in my report, I suspected that there were some traits of PTSD based on the sexual assault he endured as a kid that he didn't want to talk about, but I still nevertheless included it as a possibility, not necessarily a disorder per se. Based on the records I reviewed up to my report, the diagnosis of ASD had been, I guess,
All right, thank you, everybody.
I'm confused.
With an 8 and any.
Talking about today, the expert about Jake.
Did they really just do that?
Right?
Yes.
So, and talking to inmates, they just don't have to sit in their cell. No diagnosis because of the one-time occurrence.
Correct. Threatening, it's stressful, at least from the people I've talked to.
Now, I want to talk to you about incidents.
Those kind of things.
Okay.
They must
As far
have
as
just
anything
ended.
you use other than this,
Can it-
so
deviance. That's not a diagnosis for the DSM, and
On my part about how restrictive and repetitive his behaviors were, his interests.
I have no idea, dude. Where the
you, and what is that opinion?
Incidents like, for instance,
And like I said, I think that
investigative agencies that you referred to, did you receive records from all the different agencies that were involved in the investigation and the so were those things consistent with autism spectrum disorder or something?
I have no idea where the heck it just called up and then
The point,
I don't know why it did that.
you're not getting anywhere.
It glitched out.
Pedophilic disorder, did you?
correct.
Yeah.
All the
whatever.
records in this case, is that right?
Yeah,
Well, look at that. I'm in this stream now, dude. I don't know what the fuck. Guys, go ahead, baby.